Guam. The number is 637-0094. Give us a call. Let us know how you are weathering COVID-19. Should be staying home, washing your hands. We got a lot of info to get out. Sabrina, of course, one of the big announcements yesterday, Governor Lilian Guerrero saying that she's going to come out with an executive order that will extend the current public health emergency. There might even be a major disaster declaration coming down. And while we were saying before that, these mandatory social isolation orders were going to be in effect until March 30th, the governor yesterday said that she's going to extend that by another 14 days, so 2 weeks.
That's right. And then we have big news, big international headlines with the announcement that the 2020 Tokyo Olympics will have to wait.
Yeah,
it's being canceled.
That's off CBS News, right? What's that say?
It says that it's been postponed and canceled as, of course, because of the global COVID-19 pandemic. International Olympic Committee member Dick Pound told USA Today that the games will likely be pushed to 2021 and that a plan will be put in place on how to proceed in the next 4 weeks. On the basis of the information, the IOC is postponed and has been decided. The parameters going forward have not been determined, but the games are not going to start on July 24th. That much I know, that according to Mr. Pound, we will postpone this and begin to deal with all the ramifications of moving this, which are immense. Despite Pound's statement, International Olympic Committee Vice President Anita de France says she has not heard anything about the games being postponed. If that is the case, then you know more than a vice president of the International Olympic Committee, she said, referencing a Pound's announcement. She said it was news to her. The IOC Executive Board reportedly spoke Sunday, but allegedly did not rule out starting the Olympics on time. The only thing not on the table was canceling the games completely. While they did discuss potentially postponing it, de France says no decision has been made. The announcement from Pound comes just days after both Canada and Australia said they would not be sending athletes to the 2020 Games in Tokyo. There's been rising concern and debate over the start date of the 2020 Games over the past few months amid the coronavirus pandemic, with the CDC placing restrictions on large gatherings and the virus continuing to spread worldwide. Speculation over a possible delay or outright cancellation of the Games has begun picking up steam in recent weeks. So there you have it.
Wow. So I went down that rabbit hole last night. The rabbit hole where you start reading one national coronavirus story and then it just goes into another one. And, 45 minutes later, you're on the verge of a panic attack.
Go to sleep.
Yeah.
You know why this is also really, really interesting, you guys, is because Team Canada and Team Australia, one of the reasons why that makes it so significant is because those two nations are two countries where they provide all citizens with free healthcare.
Right.
So if they should do something like, say, theoretically, athletes went over there or fans or, the Olympic contingent went to Japan and they brought it back to their home countries, that would be a massive economic burden that they would have to endure because
I think they're already dealing with it in their countries, and so
yeah, and they don't want it to get any worse. But they were saying it's not a athlete thing; it's a global citizen thing. That's how Canada phrased it.
Wow. Yeah, so that's a big announcement. Kind of, is that overwhelming news for you guys, or is this something that we kind of saw coming?
Yeah, I think it's the right thing to do.
It is, yeah. But I mean, the Olympics,
I know.
It's kind of, it's a lot to
I thought the NBA at first when we heard that like a couple weeks ago.
Yeah. But that kind of just happened so fast. And then, things have just snowballed and escalated on so many different fronts that, a couple of days after the NBA shut down, I don't know if anyone was still talking about it. We're just kind of over it. So fast.
The next quote unquote event that people are looking at, depending on how long this thing plays out, and President Trump said this may go all the way until August, is the number one most economically lucrative sport in America is football. And they say if this extends and goes into the NFL season, that is going to make a major dent on a lot of economies.
Well, there you go. Good morning. Good morning, Guam. How you guys doing out there? I know a lot of you guys maybe just kind of processing the news that this order has been extended for another 14 days. And it's because of you guys. The governor said you guys aren't taking this order seriously. And so now, hopefully with this extension of 14 days, you will start to take it seriously. She's been telling you guys to stay home. That was kind of the message yesterday during the press conference. There was a big press conference
There was Dr. Felix Cabrera. He was on the press conference and talking about the trajectory rate of the pandemic.
Yeah, this was kind of crazy. I mean, it was kind of crazy. Dr. Felix Cabrera, who is, I guess he's the head of the governor's physician advisory
We
group.
both can't talk.
Yeah. And
Right.
he said that Guam's healthcare system, or, public healthcare institutions could reach a breaking point by the end of this week.
Yeah, we're going to have him on the air, I think around 7 o'clock, but he's an internal medicine physician. Again, as Chris said, he's part of the governor's physician advisory group. He also specializes in medical technology. And so he did present information on Guam's estimated trajectory for COVID-19 cases and its impact on hospitalized patients. And the data collected compares Guam's COVID-19 cases with other countries, as well as the trajectory of cases based on comparable rates of spread. And during that press conference, he was saying that if the government hadn't taken decisive actions and steps to mitigate the spread of the virus, the daily spread rate of COVID-19 would have been at 200%, which is the natural infection rate of the virus. That was according to the World Health Organization.
That was kind of a weird one to present that as an option. You know what I mean? I wasn't sure why that wasn't included, because I don't know of any jurisdiction that did nothing.
Yeah.
But you know what I mean? I guess in the presentation of it, it kind of made the governor look good. Like, hey, Dr. Cabrera was like, well, imagine this is bad, but what if we did absolutely nothing at all? It'd be way worse, right? Right? And that's what I kind of felt like. I'm curious about this physicians advisory group, because it's no secret the doctors have been saying one thing consistently, and the government's been saying another. So, wondering how far and hard the governor had to look to find some physicians that you're going to back up her plan.
She's got her group together.
Right.
Dr. Mike Cruz, he's the former lieutenant governor of Guam. He was
Activated.
instrumental. He was
Yeah.
instrumental in the pandemic, the government's pandemic response plan when he was lieutenant governor, I believe. So they've got the right person in there, someone with experience and knows what they're doing. And he was also part of the group. So was Dr. Hoa Win and Dr. Cabrera when we went to the Philippines
Right,
with the
yeah.
Guam Medical
Yeah.
Association to help with the super typhoon. And so, I
So
trust
he's a
him.
familiar face to you, because last night a lot of people were messaging me like, "Who's Dr. Cabrera? What's his background? Is he?" And he's been tapped by the governor to lead this, and I felt like his presentation was. It was something that we've been hearing from these doctors, and so to see it kind of validated in a platform that was basically giving out info on behalf of the governor, I felt like it was very sobering, to say the least. And the governor, she made me chuckle a little bit when she said, "I hope Dr. Cabrera's wrong." Right? So, Governor Lou, ever the optimist. We got a comment here. Dr. Cabrera's right. He is on point as the cases grew within a week span. And also a good morning to Leanne and Lynn. Hey, Facebook Live, you guys want to throw a comment there? Maybe a question? You can do that. We're reading off those all morning. A lot of calls coming in. We're going to catch up with Sinania Mayor Robert Hoffman. And there was another interesting development during that press conference yesterday, Sabrina.
Which part?
The part about the home isolation of COVID-19 positive patients. Now, this has just
Right.
been a kind of, what's a nice way to put it? Inconsistent. So we found out from the mayor's chat on Friday that they were surprised that people with COVID-19 coronavirus were being sent home to self-quarantine. When that came out, there was something about the mayor's response activity coordinator, Joey Charfris, saying that the Homeland Security advisor had said, yeah, we don't really want the public to know this because they're going to freak out, which they did. And then so we got a response with the JIC release. That was on Saturday, and that release said that, it's a temporary move. As per CDC guidelines, these people are being checked on, but they're going to be moved to the skilled nursing unit in Barragata Heights.
Right, and there was 9 that were on temporary home isolation, and then when Linda DeNorsi at the press conference, she was breaking down the figures and the numbers and of the positive COVID patients. So we were all kind of surprised when she said that there were 20 on home isolation, and I think it was 2 at GMA or SNU and 5 at the Guam Memorial Hospital.
Right, and so that was kind of surprising because I felt like, and we had just talked to Crystal yesterday morning, and she said, yeah, that was a temporary thing. They were going over to SNU, so this is just kind of another example of how this situation is, what do they say, rapidly evolving.
Rapidly evolving situation. And it is a rapidly evolving
super
situation.
rapidly evolving, apparently. Rapidly evolving back.
Yeah, and we couldn't really get an answer. I mean, I wasn't able to ask a question. I don't know. I was raising my hand in the press conference wanting to ask a question, but I was on mute, so I'm not sure what happened because one of the other reporters
probably knew you were going to ask some kind of like hard questions.
No.
We better mute this girl.
No, but
I was muted too, but I got to ask a few.
Nick tried to. He actually did try to ask. He did ask a question about home isolation, but then there was all that feedback. I'm not sure what was going on.
Really,
so I couldn't hear the answer.
And it's been frustrating because I know that Adelup and the governor's people are trying to give the media a lot of access, but this Zoom app, I've never used it. We're kind of all new to it, and these press conferences in which we're putting out, they're putting out some very important information have been interrupted one way or another by people who don't know how to figure out this Zoom app. Mm-hmm. And so yesterday, right when there was a part that was pretty important, we were listening in, and there was a member of the media who I guess didn't know his mic was on, and he was just carrying on his own conversation while we were trying to
have the press conference and listen in. Yeah, it was just the same thing. What happened with Jason, right, Jace? When you were...
Yeah. So we're figuring that out.
In my defense, I was providing tech support.
Go ahead.
In my defense, I was providing technical support.
Right. Okay. That's your story.
In my shorts with a tank top.
Right.
Well, we do have Vic De La Pena. He's saying, here are my questions. Why are we not doing house-to-house COVID-19 testing and drive-through COVID-19 testing? Can we acquire test kits from CDC or other sources to test the island population count of 170,000 and inbound travelers? Lockdown is the best suitable time to test everybody on the island and to isolate the virus.
Okay, well, first of all, we don't have enough tests to be doing drive-through tests. One of the big reveals at that press conference yesterday is they've looked at other areas, like I guess New York was one of the examples they held out, and said that they've been able to flatten the curve also in South Korea by testing a lot of people, and we just don't have that capability. But, Linda and the governor's team had said that we're getting test kits. They had something on that in that release?
Right. They had received 200 test kits over the weekend, and I believe they're expecting more test kits, and that she had signed a contract with DLS, and but I believe that is for testing.
To send results off island, I think.
But last night, when the Joint Information Center issued their latest update, when they announced that there were 2 additional confirmed cases of COVID-19, which brought the total to, what are we at, 29? 29? Yeah, 29 positive cases. They did include in that release testing limited to priority groups. So, as you mentioned, there's a shortage of supplies needed to conduct advanced, accurate testing for COVID-19 island-wide and nationally. The governor's medical advisory group provided guidance for COVID-19 prioritization of testing. And at this time, there are 4 specific groups that will be prioritized for testing. The first, hospitalized and emergency room patients with COVID-19 symptoms. These patients are already sick, and our healthcare providers must be protected. Early identification of a COVID-19 infection will keep our hospitals safe. 2, people with chronic diseases and COVID-19 symptoms, diabetes, cancer, advanced kidney disease, and others. These members of our community have an increased risk of becoming severely ill or even dying from COVID-19 infection. They need to be diagnosed as early as possible. Now, the third for priority testing, healthcare workers and first responders with COVID-19 symptoms. And 4, older people with symptoms of COVID-19. It's very clear that older people infected with COVID-19 get sicker faster and die at a much higher rate compared to younger people. Testing for individuals outside these groups is not recommended until more testing supplies become available. Public Health and GovGuam continue the effort to obtain more test kits. This means the public health laboratory will not be testing mildly sick people with symptoms at this time. People who are sick with mild symptoms should stay home and self-quarantine for 14 days from the first day that their symptoms began. If you're sick with mild symptoms and have elderly relatives at home, you should separate yourself from them or separate your household if possible. Until further advised, do not go to clinics for testing unless you have serious symptoms. Again, those are the 4 specific groups that have been prioritized for testing.
Right, and so that's kind of some new information there. I wasn't sure who they were testing, how they were testing them, and we didn't know. We've been asking how much of the testing being done is a result of these multiple trace investigations that the Department of Public Health is going through, and so it kind of seems like they're just laundry listing. Hey, let's go through GMH. Everybody who's exhibiting the symptoms, let's test them right away. Maybe to get a handle on that exposure that happened maybe last week.
Which, the bingo or which?
The hospital.
Oh,
yeah.
Sorry, I'm a little blurry here. Could be.
It could be. So there you go. We'll read that
then,
again.
Then there was also the Vicar General. Was it Father Jeff St. Nicholas? He had paid a visit to the Guam Memorial Hospital.
Right, to do last rites.
Right, and he had to be self-quarantined for 14 days.
Yeah, and so did Dr. Akamoto, but he's been cleared of COVID-19.
Dr. Akamoto, is that what you said?
Yeah.
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 I'm just trying to go through this comment.
Right, so what you got there?
Debbie Davis, she writes, in Kentucky, if someone tests positive for virus, they are sent home to self-quarantine. If they leave their home, they are then placed on ankle monitor and will have charges brought against them if they try to leave their homes again. But a lot of people are following these orders. Only if you are not. Please follow what the doctors in charge tell you and don't panic. Wow, on ankle monitor. I wonder how are they going to monitoring all these 20 COVID positive patients?
Me and Sabrina, we're just going to have to take their word for it. Linda said that they're being checked,
by public health.
By public health a couple times a day. But, I think the public is right in calling for more transparency. The mayors are right. They feel like, hey, if these patients are home isolating, Messiah, give us a heads up. Let us know so that we can, maybe lock down the village a little more. Right. To help avoid the spread of COVID-19. Mm-hmm. We had a comment here from Veronica. There were 3 inconclusive results from last night. What does that mean? That means that they're going to have to be run those tests again. I think there was something in the release.
No, it does say that.
So what does it say?
They tested 37 individuals for COVID-19 on Monday with conclusive results. 2 tested positive for for COVID, and 35 tested negative for COVID. A total of 190 tests were performed to date with conclusive results. To date, a total of 29 cases tested positive and 161 cases tested negative, with 1 death. All 28 remaining confirmed cases are in isolation. I don't see that about inconclusive. All right,
we'll look for that. At 6:20, we got to take a break. We'll get you up to speed on news, and then we're going to start getting people on the phone. Our friend Tomas Maglotnia is going to be calling in this morning to kind of give us his assessment of,
Is he in Saipan or Rota yet?
I think he's still in Saipan, okay. Yeah. So that's coming up at 6:20. Guam's favorite, the KUAM News Takeover containing COVID. Good morning.
KUAM News Updates are brought to you by McDonald's of Guam. I'm loving it.
Half a day Guam, here's what's making headlines from Monday.
of the 158 tests conducted since Sunday, Guam now has 27 positive COVID-19 patients, with 131 testing negative. 20 patients are on home isolation, 2 are at the skilled nursing unit, 5 at the Guam Memorial Hospital. In terms of where they are from, 5 are from northern Guam, 12 central Guam, 4 are from southern Guam, and according to Public Health Director Linda DeNorsi, 6 are unknown. The age ranges 20 to 29. There are 3 positive confirmed patients, 30 to 39, 3, 40 to 49, 5, 50 to 59, 4, 60 to 69 years old, 9, 80 to 89 years old, 2. In terms of their gender, the breakdown, 10 are male, 17 are female. As for their health conditions, 15 are stable and 12 are in fair condition. As for their travel history, 1 from Japan, 5 came from the Philippines, 1 Korea, and 1 from the U.S. mainland. 20 have no travel history.
Today it's day 5 of quarantine, just trying to soak up some of this late day sun, get some vitamin D. It's good for you, so is vitamin C. According to all the research I've done, if you can get some, get some. We're here in quarantine, not much has changed. I want to thank everyone who's called and reached out and texted to check up on us here in quarantine. It's going. They feed us 3 meals a day. The food truck Guam and their crew have been very good about keeping us nourished and meeting people's dietary needs. At least in my case, I encourage anyone who has any dietary needs to reach out to them. Other than that, not much going on. We still get temperature checks, but now it's once a day. If you continue to answer no to the questionnaire, they will just come in the mornings and give you a temperature check. I've been consistently reading about 96.5 temperature, so I feel good. Can't wait to go home, but still, I mean, this thing doesn't show itself right away, so symptoms can come up later. Pray to God it doesn't show up for anyone here in quarantine or anyone else on island. Message is still stay home. We had a spike of 15 people just yesterday, and that's expected to rise. If you have been following the trend, what's been happening around the world. I have been following what's been happening in Manila and other countries where I was staying. That's just the beginning. If those people, 15 people went out and were socializing and not being safe, then they probably infected people. Remember, it's asymptomatic. They're not going to show any signs of this virus. So please stay home. For the love of your family, stay home. That's all you got to do, and so we can figure this out. If we overwhelm the healthcare system, then God help us. That's all you can do is stay home. That's all we were asked to do is stay home. Stop fighting the system. Stop talking about martial law. It's not. It's just for the good of our island and our people. Stay home. We're here another 9 days. You guys can do it. I'm doing it here with everyone else in quarantine. Like I said again, I know people said it's hard to stay home. If you have to go out, be safe, sanitize, limit your movements, come home, stay home, wash your clothes, don't bring it into the house.
DOL Director Dave De La Sola says the $100 million dislocated worker grant is being converted.
It's Tuesday, the 24th day of March. Of course, the governor's social isolation orders and public health emergency declaration have been extended for another 14 days, which if you do the math, it means we're going all the way to April 13th on this. 626. So, one of the things that we were kind of asking for was more detailed information on those who test positive for COVID-19. And yesterday we did get a breakdown, right, Bree?
Yeah, we did. Let me pull it up real quick. And this is just based on the 27 confirmed cases from Sunday, and this is the breakdown. This does not include the 2 from confirmed cases from yesterday. So 20 patients, as I mentioned earlier, are on home isolation. 2 are at the skilled nursing unit in Barrigada Heights, and 5 are at the Guam Memorial Hospital. 5 are from northern Guam, 12 central Guam, 4 from southern Guam, and 6 are still under investigation for place of residence. The age ranges from 20 to 29, there are 3 confirmed cases. 30 to 39 years old, there are 3 cases. 40 to 49 years old, there are 5 positive cases. 50 to 59, there are 4. 60 to 69 years old, there are 9. 70 to 79 years old, there's 0. 80 to 89, there's 2. And over 90 years old, there is 1 positive patient. The gender breakdown, 10 are male and 17 are female. Their health condition, 15 are stable, 11 are fair, and then we have 1 that is deceased. And now for a breakdown of their travel history, 1 Japan, 5 from Philippines, 1 Korea, 1 from U.S. mainland, and 20 have no travel history.
628. Can we bring Mayor Hoffman up? Are you done with that?
Yeah, I'm done.
Okay. So let's get Mayor Hoffman. He's been advocating for transparency. Mayor, were you satisfied when they released more information about the COVID positive patients yesterday?
For me personally, because I know some of the people that actually do have it. Mm-hmm. That I was aware of it there, but I'm hoping at least they started to give some of the information. I know they're still doing backtracking, but just in our little discussion with the mayors, at least we kind of have an overview of where it might be and stuff like that in that sense. So it was between that and then finding, again with the home isolations, we posed the question again, and they said that they were moving them, or they're moving some of them in a specific area, and there was, I guess, they needed a larger area. Now that the numbers jumped on Sunday, that they ended up having to get another specific area. So now they were doing all these transports and kind of shifting these people around. So I think that's what they've been doing yesterday.
So you did have a conversation. The mayors had a conversation with the government.
Yes. About that specifically, because after you raised that question with me, Sabrina, I said, by the way, did I just hear that correctly? They're still at home isolation? I thought they were being moved. And they said, well, they said they needed a facility, and it's harder to spread people around in, I guess, the 3 sites that they had between the airport quarantine folks. So they kind of, make their resources all into one, so it's easier to guard and protect and sanitize. So it took a while for them to prepare actually a facility. They have to go in there, clean it and sanitize it, move everything, stock it with everything it needs, and then from there doing the transport and doing the logistics for it.
So what did they tell you the SNU facility was there? What's the capacity there? 40?
I think it's a 60 bed.
60 bed facility, and only when we last spoke with them, it was only 2 wards were ready out of the 3.
I think 1 ward was ready, and they had moved 2 patients, maybe.
Mm-hmm.
I think those are for the ones that I guess are in that critical or the fair part, but the ones that are asymptomatic, they're at a separate location.
Right. Do you know that location, Mayor?
Mm-hmm.
I believe. If I'm not mistaken, I believe it's the Pacific Star.
Right. Yeah, that's what.
Wait, that's Pacific Stars for who?
The Pacific Star, the asymptomatic.
For asymptomatic.
Yeah.
Okay.
Okay, because I had actually messaged Crystal yesterday about situations with the people who are in quarantine at the approved quarantine facilities, and she had mentioned that there were. Let me just pull it up because.
Yeah, it's hard. It's constantly changing.
Yes,
it's a rapidly evolving, Mayor. That's what we're saying.
Some of the people that are in quarantine are being transferred. And I think there's a difference between whether you're on quarantine and you're on home isolation. This specifically
home isolation means you got it. I mean, you're
right,
positive.
and quarantine is, you need to stay away from the public for the 14 days. But
Right.
Yeah,
she can't.
For those of the home isolation, I think the governor said yesterday if they don't have a separate bathroom, they have problems trying to home isolate because either the number of people in the house or they also don't have a separate bathroom, separate bedroom that's required. If they don't have that, then that's where the government kind of steps in to kind of put them into an accommodation. So
Right.
I believe that's what's going on right now.
So the SNU, are we saying that it might not have separate bathrooms in each?
But I think it's because it's a medical facility. Those that without symptoms, that is not needing any kind of respirator and all the other stuff. I think they're moving into just a specific area where they can just write it out.
But you're hearing that the possibilities that they're going to move the home isolation patients to the Pacific Star, not the quarantine passengers?
The ones that are home isolation that can't meet the requirement, from what our discussion, I think we took away from it, our takeaway was that they're being moved to a specific facility that's easier to I guess no community exposure.
Mm-hmm.
Right.
So I think they're trying to convince everybody to kind of go ahead and go to report or get picked up and go there. But I know that public health's been calling those that are home isolation twice a day. They are checking up on them. The surveillance teams are out there. I know because people, like I said, the people that I know are being called. They're like, wow, they're
like house arrest.
Being called. Yeah, they're being called. They're being visited. So I was like, okay, this is, they're kind of getting into the flow of this, and they're kind of seeing the way of it. And so even with some of our Manamco here, even though they're not positive whatsoever, because they were on that list, they were being called twice a day. Also, just double checking on them. I believe Friday is kind of their clear day. If they no symptoms by the time Friday, that means they weren't exposed to any kind of the virus. So we're all just waiting for Friday on our end to see, and then that at least our 70 Manamco within that facility would be at least breathe that sigh of relief.
Yeah, but then they would still just stay indoors and
they would still stay indoors. They are bored every time I talk to them. So today's going to be the first time. None of them can, because some of them want to come by and pick up their meals. So all of them were being told by public health yesterday in their call saying, "Do not go anywhere. We're almost out of that gate there, so do not go anywhere. We'll bring the food to you." So we're just coordinating that with all our various mayors.
So, Mayor, it kind of sounds like they did things and you changed your tune. So you're now satisfied with.
We're still asking village specifics. That's something we're still pressing for on that end, and we still want at least the information that the doctors are asking for, the clinics, places they've been to. We're still asking for that. So we're just, we're trying to flatten that curve, and we said, help us help you. That's basically been our mantra to them, saying help, and hoping that's kind of falling on the ears that need to happen. And what concerned us when they released the statistics, there were 6 villages that were unknown, or 6 cases that are unknown. I was like, how do you have unknown
residents? Yeah,
these people can talk. So it's not like they don't have, or they have family members there, and
right?
They brought them to sign them in. So we're pressing for that information.
And what's the response been like, Mayor? Do you think that this is going to be something that you guys are going to get, or are they just not budging on it?
I believe they're going to get it. I think it has to go through like 3 or 4 different channels. So wherever they were tested, then it's whoever I took was the receiving report. Because there's no one place I think they go. Like I think the people who have the results in the lab have to match it up to, I guess they don't put a name, they put a unique coded number or whatever else like that, and all these. So it goes to like 3 or 4 different people. So we're just trying to figure out, are we asking the right people? And we're asking Homeland, who we're told to deal with. But I think Homeland asks Public Health, and Public Health asks GMH, and GMH. So I think it goes some channel.
Was this a Zoom media, a Zoom conference, or how did you guys meet? Was it all the mayors, or?
We were invited to participate, and we just rather watch it. So I watched it from your website instead of dialing in, because I saw what happened with some of those other reporters there. It was kind of interesting.
So putting it mildly. Hey, how about that Zoom app? You ever download that Zoom app? That's pretty cool, right? Yeah, I'm on it right now.
Just dial the phone number and then put in that code.
No, but did the mayors have a conference with the governor or the Homeland people? Was this a meeting that you guys usually have on Mondays?
No, we've been communicating just when we have a specific WhatsApp chat
So,
for it.
okay.
And then that's basically we're just dealing on that is representative of the governor's office, somebody from Homeland, and I think that's it. The two that we're dealing with on this specific for that.
Mayor, we had a comment here from Alicia. I think it's crazy how residents that tested positive are being sent home to do home quarantine, which is risking the other residents in their household possibly becoming positive.
Just
Yeah,
there's a
they-
difference:
they-
home
they-
quarantine and home isolation.
Right,
So
yeah.
just
Well, I think she means home
home
isolation.
isolation.
Right.
Yeah, home isolation. Yeah, I think they signed these papers that are saying that, it's like I promise not to go out and I got to do this and do that and I will meet the requirements. So at least I believe now that they do that, and with these inspections, stuff like that, it kind of does offer some layer of, okay, you are meeting the requirement and you are staying home, because I think they know that they're infectious in a way, and I'm just hoping they're family members. But I agree with Alicia on that, and I would feel more comfortable knowing they're somewhere specific and isolated, at least write it out for the next 14 days. I mean, the more that people don't stay home and the more that people go out and more they become potentially hazardous, we're going to keep kicking the can down the road and extending this closure of the government till beyond April.
Just for clarification, your understanding based on your communications via WhatsApp is that these home isolation positive confirmed patients, the plan is to move them to the Pacific Star? If their
Pacific
homes
Star,
don't meet certain guidelines?
Criteria, yeah, yes.
Okay, because I was under the understanding that it was the quarantine passengers.
Yeah, they're using 3 hotels or something like that. Wyndham, Days Inn, and Pacific Star or something like that, I believe.
Right. No. But okay, wait.
Yeah. For quarantine passengers, so the government's using 3 facilities. Where
Right.
they're placing them, it's kind of like I guess they're moving them around depending on what resources they need to do that. So I think they're trying to clear out one area to prepare it for another area, for another arrival of another group, or some sort of that way.
Mm-hmm.
So I know they're actively testing, because several of the people that arrived were also tested.
Right. Yeah. But one of the quarantine passengers that communicates with us, he gets tested. He was getting tested twice daily, and I think it's down to 1. That's Dave Sablon. We're going to have him on later. Mm-hmm. But I just want to make sure we're clear. You're saying the home isolation positive patients are going to PacStar.
Only if their house doesn't have
right.
what they need to do home isolation in a manner the public health.
And I believe they're given the option to do all those things, and I'm not sure if they're being ordered to move over yet. We're going to be asking that question today, of how many were transported, how many were able to avail themselves of that opportunity to home isolate in a specific place. And I think for some of them who are positive, who are in home isolation, they might require care, because some of them are elderly. Mm-hmm. They might require some kind of care, and I think so. That's probably the better option for them, is to be at a home isolation for that. So that's something that we talked about. Some of them require, some of them are elderly that require some assistance, but now it's making sure that family member does all the proper sanitation.
Right. I feel like it's putting a lot of pressure on the family members. And
it is. It's
Mayor,
hard to do. So,
in a perfect world, though, if you had your way, Robert Hoffman's calling the shots. Oh Lordy, would you want all COVID-19 positive patients to be housed in some type of quasi-government isolation facility, as opposed to them just being at home?
Yes. It would give everybody else a sigh of relief on that end, and then it could make everybody focus just on the testing and sanitation of the community and everything else that we can do, because we're asking, is any of these positive cases related to each other where they would have been exposed, and we're still waiting for the answers on that, because that the number that's climbed was we're trying to figure out, was that jump because those people in home isolation or around that were exposed to people who were positive, and we didn't get an answer on that.
Yeah, and I think that's the problem, is we're doing a lot of guesswork over here.
Mm-hmm.
Yes,
trying to fill in the gaps.
The mayor, I feel bad for my colleague, Mayor Mauricio. He's still trying to figure out, because that bingo thing hasn't really concerned, especially when now the numbers came out kind of saying they're from the South. He's trying to put 2 and 2 together on that end. But, he's had, I think 2 times they had bingo fundraisers or something around that of that manner. And so he's kind of, he's been asking for answers of where specifically and what dates, and he's trying to get a hold of residents. So, if they can release at least, some facilities, some activity that happened. What about the rest of those other cases? Where did they work? What did they do? Why is it taking this long?
I wanted to follow up again on that home isolation, but this one about so home isolation. From what you understand, if they don't meet guidelines, they'll be moved to Pacific Star. But for quarantine passengers, what are you hearing? Are you hearing that they're going to be moved as well, or staying put?
No, not that I know of. I know that I think from what we gather from it is that they're just trying to consolidate, so they're not stretching out the resources. I think if anyone's gone up to SNU, it's almost like entering a military base. You pass two sentries, and then you have all these other things. It's a really guarded area. That we're actually, the mayor of Barragata is having a problem because there's residents who live behind the area. So she's actually had to make a car pass for her residents who live there, so they don't constantly get stopped and get, given the whole rundown of what are you doing here? Why are you here?
Right.
Like, we live further down. How many times and the guard constantly changes, and the several guards change. So
right.
She asked us yesterday, is it okay if I make your own pass? And I said, make your own pass and just tell them I am a resident of this street. But so I think it's just a matter of them consolidating resources, putting where it needs to be. So the passengers who are showing no symptoms, who are under that quarantine rule, don't have as much. They're still guarded, but I guess not as protected as people who are under that home isolation or the isolation order and being moved to a specific area where they can actually have more people either in the hallways or the road and the entrance of the lobby and all the other places, those hotels. I mean, bless those hotels for stepping up. I mean, that's a hard thing to do.
Mm-hmm. Yeah, because from what I understand, there's 3 quarantine facilities: Wyndham Garden, Days Inn, and Santa Fe. And then, yesterday we got word that they were moving some of the quarantine passengers to Pac Star. That's why I'm kind of confused about now you're hearing that home isolation patients are moving to Pac Star.
Well, maybe we'll get that info later
today.
Well,
there's going to be a press conference at 1 o'clock, and according to what Crystal mentioned yesterday in a chat that I had with her, is that there's supposed to be more information related to the movement of quarantine passengers to another facility.
We had another comment here from Pam. Why are we moving and mixing everyone around? Persons under investigation and confirmed cases are all moving around. Can we skip the home isolation? How come the confirmed cases get to choose and passengers from Manila are mandated to stay at the hotel? That is confusing.
It is, and I think that's we brought that up several times, and we're just trying to see. We understand it's for the health of everybody, and we're just trying to see. I think if there was more test kits, it would be easier to kind of not have to take those Manila passengers and put them in at these places. But it's the number of facilities that are available, and I think that's what the word we got was that they're just trying to work on procuring, preparing, and all the other things of these facilities. So, yeah, it is confusing, and that's something I will ask this morning.
Right. Well, there you go. Thank you, Mayor Hoffman. Anything? Did you watch the press conference? Did you have anything to add on maybe Dr. Cabrera's comments about the healthcare system reaching its breaking point?
It is. It's an eye opener for us. I mean, the 200% versus the 33%, which I prefer to see 0. I prefer it to be lower, and I think it's just people want the areas closed and Guam on lockdown, and it's just I'm surprised really that the military, the federal workers, and civilian federal workers are still not being told to stay home, and they're still going out and about, and their office spaces can range in terms of the number of people, so it doesn't help when not everybody's participating. I saw a bunch of posts yesterday when a lot of other companies that weren't usually closing are finally closing or reducing hours, whichever else like that. But I think it's easier. They said it, and I read that if you just completely lock it down and just everything stops.
Right. Yeah. And it's interesting how they're holding up these other places as kind of an example, and then doing things that those other places aren't doing, like less stringent lockdowns or mandatory social isolation orders.
Yep, it's hard, and I think it's I don't think no matter what Guam does, I think it's just going to be hard to do because the rest of the world still hasn't kicked it, and so we could be corona free for 3 or 4 days, show no testing, no spread. It just takes 1 or 2 passengers coming home from.
Right, and that's what we're seeing in
else.
Hong Kong. I was reading something about Hong Kong where they had managed to flatten the curve, and then with imported cases, they're almost right back where they started from.
Hong Kong and Taipei, Taiwan, that's happening right now, and
right.
I just read the reports that China is expecting the second wave of this coronavirus. So it's concerning.
Yeah, it is. I went down that rabbit hole too last night, Mayor. I was, clicked on one national story, after just reading about everything that's going on here. I was like, let me just click on this, an hour later, about 3 panic attacks after. I was like, let me just.
I agree. I was just like, man, world, get it together. Figure this out.
Because we're following your lead, right?
Yeah.
Okay.
Yeah, so it's hard to do. But yeah, we remain hopeful, and we continue to pray, and which that's the least we can do. But we're going to ask those questions, and if you have any questions, you let me know. Not get it hold of me, and we'll post it to the powers that be.
Okay. Thank you, Mayor.
Thanks, Mayor.
All right. Take care. God bless.
All right, there you go. You too. Wash your hands. Yep. Good advice there. Mayor Robert Hoffman. I really want to, I think it's very courageous of the mayors to kind of to speak out and, to demand information for the sake of their constituents, right? Because they're out there. A lot of times we're insulated. The governor's people are insulated in a bunker, maybe kind of removed from what's happening out here.
Mm-hmm. I just find it amazing that they're finding out information when we're finding out. Because I did, after the press conference, I called Mayor Hoffman, as you mentioned, and I was like, did you know that there were 20 on home isolation? And he was like, what?
Yeah.
Like, let me call you back.
It was confusing because we were told one thing. I mean, we found out. Did a story, and then it was, oh no, it's just temporary. They're being checked on,
and they're going to be moved to SNU.
Right, and so I guess what they're doing to the caveat, the kind of asterisk on everything, is that it's a rapidly evolving situation.
Yeah, and I get it, it is, but
we just got to be kept in the loop so we can tell you guys, how evolving we are. Daily.
Yeah, and if you're going to keep them on home isolation, or you should have just said that from the beginning, so nobody would have been alarmed about it.
Right, and now what is happening is people just don't know what the hell to believe because the government's saying one thing, and the next day they change their mind, then they go and change it back. And anyway, so I think this is Tomas McGlutton. Tomas.
Hi, Chris.
Hey, good morning.
Hey, Tomas.
All right, of course, you guys may know Tomas. I hope you remember him from last year. He did some work with us, some great work. And he's now back. You were going to college in the States, online classes for the rest of the year or semester or what?
Yes, that's right. So in-person classes were canceled, and I'm back here in Saipan.
How are things going up in Saipan?
It's a rapidly evolving situation, just like everywhere else. There's so many updates in terms of schools, hospitals, the local government. As I was sharing with Chris yesterday over chat, the CNMI public school system just decided to end school for the rest of this for the school year, for the remainder of the school year. So that's our current situation, and the public school system is actually going to start passing out free lunches to students this Wednesday. So there's lots of efforts happening across both Tinian, Rhoda, and Saipan with regards to COVID-19.
Wow, that's some new information we didn't know about, and now that's going to get people talking here on Guam. Do we need to cancel school for the rest of the year?
Yes, I think one of the decisions that the Commissioner of Education here, Alfred Ada, decided is simply because of the social distancing, guidelines, and also because lots of students don't have laptops or any technology to take learning online. So it was about a 2-paragraph statement that the Commissioner of Education released last night. And also I reached out to the hospital to ask them about their current situation here in Saipan, because I think yesterday when I was watching the show, the press secretary on Guam, Crystal Paco, clarified that test kits sent from the CNMI are not tested on Guam, but just repackaged and sent elsewhere. And so I reached out to the hospital and got numbers back about the testing on island. And the latest information we have right now is that the Commonwealth Health Center is planning to have COVID-19 test kit abilities in late April or early May. So that's what it's looking like for the CNMI.
Wow.
So you could have positive COVID cases and you just don't know it because there's no ability to test, and you're waiting for test results tests that were sent here to be repackaged and sent off island.
That's correct. Yeah, I believe that when a case does pop up, the terminology that's being used in the CNMI is surveillance cases. So they're just surveilling to see who has cases. Right now, as you know, there's no confirmed cases, but I think it's a matter of when, not if,
So just curious, so are you guys getting results from whatever tests that have been repackaged and sent off island from here?
Yes, I believe the last. Well, I was surprised to hear Crystal Paco say that the test results were not being done on Guam, because I believe that was the impression everyone was under based on the press release that the CNMI governor released, saying that the results came back from Guam. But as it was clarified on this show yesterday, that's not necessarily the case. I think also receiving some numbers in terms of the number of beds at the hospitals on Saipan. There's about 75 beds in the hospital and just 17 ventilators. There's just one ventilator on Rhoda, and I didn't get any numbers for how many ventilators are in Tinian, if any.
Well, we're facing the same issues here, Tomas. There's a shortage of ventilators. This is something you're seeing nationally. I mean, I saw a story about how they're trying to MacGyver ventilators in the same way they're trying to MacGyver. Google it, kids, if you don't know what is MacGyver. But they're MacGyvering the masks. The healthcare workers, shortage of supplies. They're trying to find creative ways to make things happen. So, I mean, we're dealing with that. One ventilator for Rhoda. That's I don't know what to say.
Yeah, it's a bit of a grim picture, but it's an honest one. And I think that, speaking with my dad and stepmom who live on Rhoda yesterday, and they decided not to go to a family friend's funeral that had more than 50 people, and decided to just pray at home and offer their condolences through the phone and video chat. And I think that's the new reality that's setting in, especially for a community like Rhoda that might, be more susceptible with not as good of an infrastructure as the other islands.
Wow, I'm still speechless.
Yeah.
So how many tests have been conducted? Do you know?
My understanding is that it's about a handful. I don't have the exact number at hand. I just know that, of course, we still remain with no confirmed cases. I think another thing that is catching the attention of folks here is that business operations now are restricted to 6 a.m. to 1 p.m. The governor released a directive, and I think similar to Guam, there's still a few people who might not be heeding these directives. Yesterday, when my cousin went to pick up some takeout food, one restaurant was still hosting in person at the table customers, and all of our churches here also went completely online. And I think with or without COVID, so the reason why they went online is because they had several priests returned from a retreat in the Philippines, and so public masses are now all online until the 28th of this month. And so the priests are self-isolating now, and I think another new development is that effective March 23rd, so as of yesterday, everyone, whether you're a CNMI resident or a tourist, is under a 14-day consecutive day mandatory quarantine, and we understand that is happening at several, one or two hotels. One of the hotels that I know of that it's happening at is Century Hotel here on Saipan. So whether you're a tourist or a CNMI resident, you're going to be brought to these facilities or these hotels to self-isolate from the airport.
Wow, I'm still back at, they've limited business hours, 6 a.m. to 1 p.m. On Saipan. Is this throughout the NMI, Tomas? Is this also Tinian and Rhoda too?
Yeah, so the governor released an amendment to the directive stating that. I can pull it up to make sure that the information, I'm not sure if it's just applied to weekdays or weekends, but it's definitely the new case that people are adjusting to here.
Right, yeah, we just had a comment. The Guam Department of Education, this is from Sam, should follow our neighbors' lead. They're taking action before they get positive patients. Stop the spread, stay home. Now, just to be clear, there's been no announcement from our Department of Education here on Guam that they plan on resuming classes. I think they haven't even got there yet. We just went through our, as you know, Tomas, the governor extended the public health emergency for another 14 days yesterday.
Yes, it's like everyone's calling it a new reality, and I think especially for the public school system, this might be the best practice. It's also something that a lot of students and families are disappointed about and, of course, concerned because there's still a lot left of this school year. I think, though, and they released a survey asking parents to fill out whether or not they have a stable internet connection or technology available to use it. I don't think I need to point out that folks with no internet and no technology cannot fill that survey out. So I think that in terms of supporting students completely online, it's almost impossible to do with our current situation.
I mean, even on Guam, Tomas, we've got so many children and families living in poverty here that every public school student gets free meals from the public schools. So, I mean, if we can't even afford to buy these kids lunch, I think it's a stretch to assume that everybody's got internet.
Yeah, Chris, is it okay if I read to you the amendment to the directive that was actually sent out with regards to business hours?
How many pages is it, Tomas?
I just want to make sure, it's just a line or two. So it says, effective today, all businesses that have facilities open to the general public shall only be open to the public from 6 a.m. to 1 p.m. Outside of those hours, businesses may operate but may not be open to the general public. That is the directive. It's a two-page directive that was added on to the original executive order that the governor signed.
Well, and so our governor here on Guam has closed the beaches and parks. We're going to talk about that later. And she also had alluded to, and this is just banks, because that's kind of what I asked about. She had said that there may be a situation where they ask banks, and I'm assuming other businesses that are allowed to be open, to completely close. So, my feeling, do we want to just do that now and get it over with and, hunker down? Or because I feel like there's a lot of, and we talked about this, governor closes the parks and beaches, but then there's that exception where, if you're going to go running or hiking the beach, then you can go. I think people just need to know, is it closed or is it not? And when you start allowing people some wiggle room, we're seeing what happens is they're going to wiggle.
Yeah, I think, that definitely speaks to maybe a message that's not unified across sectors. I think definitely needing to hear every day what the update is, even if the update is there's no update. I think it's important to hear it.
Right.
There's also cases here that I saw yesterday. It was on the front page of the local media about price gouging that's happening here in the islands. There was one report of a bottle of hand sanitizer being sold for $10 at one store. And as you know, there's a price freeze in effect for the Sinamai since the emergency was declared. So lots of moving parts and lots of anxiety on the part of the people living here, of course, justified.
All right. Well, thanks, Tomas, for checking in with us. I think we'll check in with you a little more because I think it's important for people here and people over there to know what's going on. So thank you so much. And be safe.
Yeah, and you keep in touch. You got our numbers. Let us know what's going on there.
Will do. Thank you, guys.
All right. There you go. Tomas Manglotnia. Man, a lot of info there, especially just kind of wanted to bridge the gap with our NMI listeners.
Okay, and can I just dovetail on something? Because you guys were talking about, what John Fernandez and what possibly might go on with GDOE the remaining of the school year.
Right.
We did an interview, Adriana Cotero did with the superintendent, John Fernandez, yesterday. It's on our YouTube channel. It's on Facebook right now. If you guys want to see what the tentative plan is as far as, everybody's wondering what's up with fourth quarter. Of course, obviously the class of 2020 is what's going on with graduation. John did speculate on that, and it is, at this point, speculation. It's in the planning stages right now, so we invite you to go and stream that interview. It's a lot of information, a lot of stuff that you guys can really use to clear up some of the confusion if you are wondering what is going on with the future of school on Guam. And he's also talked about the grab and go program. He wanted to emphasize too, it's 11 to 1 every day at 11 campuses, 11 sites throughout the island. That's in that interview too, so you can go there, check it. It's for all students. He highly stressed that, private or public school.
Private, yeah. Thanks, Jay. All right, so you check that out. We might get some of the clips up on the show, but we got Dr. Felix Cabrera. We're going to be getting him on the line in just a matter of moments to kind of give us some more information on his
trajectory
and the very alarming trajectory.
Trajectory.
It's been a long year.
Trajectory.
And also, there was a Facebook post that we're going to talk about. I'll just save it for a little bit later.
Okay.
At 7 a.m., we're KUAM-FM, Hagatni, Guam, containing COVID. Good morning.
KUAM News Updates are brought to you by
Like many in her field, University of Guam Dean of Nursing Margaret Hattori Uchima is concerned about just how stretched thin Guam's healthcare professionals are. Uchima says these critical shortages existed long before COVID-19 started making headlines nationally and locally.
We've been crying for help for GMH for years. This is not anything new.
Yeah.
And so we haven't bolstered that system. We've always had a nursing shortage. We have a physician shortage.
Uchima says the Guam Board of Nurse Examiners, through the governor's public health emergency declaration, has been able to do more to help recruit crucial positions. She adds that nurses from around the island, including school nurses, have been activated as well. So if you think you can help, if you have any sort of medical background, you are needed.
We have had nurses that have a Philippine license that didn't get a U.S. one yet. And they can get a temporary Guam license if they meet certain criteria.
She also said retired nurses have reached out to help, and Uchima saying at this point any and all volunteers are needed, even for something as simple as answering phone calls. And while nurses, doctors, and medical staff are on the front lines of the COVID-19 battle, Uchima said it's good to know they aren't alone in that fight.
I have people texting me day and night saying, what can I do to help? I have people right now getting food for nurses. All weekend we've been trying to make sure that the people on the front, have the supplies and the food. So, it's early in the game, Chris.
Uchima said she has been touched so deeply by Guam's generous nature, and it couldn't come in a better time.
I'm not one to ask for help, but, the last week, I don't care. I'm calling anybody I know saying, hey, can you donate water?
Right.
And people are pulling through. It's amazing.
If you want to help, reach out to the Guam Board of Nurse Examiners at 735-7408 or 7409. For Guam's News Network, Chris Barnett reports.
DOL Director Dave De La Sola says the $100 million dislocated worker grant is being converted to a temporary recovery work grant in which laid-off employees will be paid to help with the recovery.
Once this quarantine has been lifted and we're starting to reach some normalcy, then we will take some of these people who are temporarily laid off and start to put them to work. What we're going to do is put them out to the quarantine sites to help clean up, help prepare meals, help the schools, the hospitals, and the mayors all clean up the facilities and get them ready for use.
But that's not all. De La Sola says GovGuam will also be applying for the Disaster Unemployment Assistance Program, which could pay qualified displaced employees an average of $500 to $600 a week. He says they've begun seeking information from employers and their employees that's needed for the federal grant application.
We already started the template. We are starting the application. And once that declaration comes in, that'll give us information on what to put in that application exactly. But usually, if we are awarded, which I'm sure we will be, it'll be a weekly check going out to all the people.
Guam DOL is still waiting on the grant details from the U.S. Labor Department. They'll be soliciting information from employers and employees. The website is rapidresponse@dol.guam.gov. For Guam's News Network, I'm Nestor Lecanto.
Tomorrow pride is what we say each and every day from G-Go down.
Worst best tomorrow ever. The understatement. 706 KUAM FM, Agotni, Guam. Good morning. And thanks for watching and listening on our KUAM News Facebook live feed. Leave some comments. We're trying to get those out. And Red Fausto chimes in here. Home isolation is all wrong. If there are other family members in the house, it's likely that they can get the virus and spread it to others. Moreover, if the house has aircon, the virus loves the cold and lives longer. Also, if an infected individual kisses their pet, and someone else does the same, that individual may get it too. Don't be ignorant.
Right, and they're supposed to be following the guidelines that you're not supposed to have any
Yeah,
contact.
okay. How
leave
many
the
of you
door
guys listen to
closed,
your doctor?
And they're being monitored by public health.
Right. But I think that's generally how people feel about it. They feel like, we're kind of behind the curve. We need to flatten the curve. So let's get these people in an environment where maybe there's a little more medical supervision, and so, well, that's what it is. It is what it is. Guam, I don't want to say just deal with it, but apparently that's what is happening. 7:08, it is Tuesday, March 24th, and let's get Dr. Felix Cabrera on the show. Good morning, doctor.
Hi, good morning.
Half a day.
So your presentation yesterday, I felt was very, very alarming. Can we just start with that?
Sure. With what we did is when we ran these models of, what our trajectory is here on Guam based on the limited data that we have so far. We're only so many days into this pandemic, but right away you could see that we were matching, the trajectory for most of the globe. And knowing that and understanding how that applies to our resources here in Guam, in particular, the most critical part of our resources, which is our hospitals and the critical beds that we have, that's where we needed to have a better understanding of what we were actually dealing with and when things may reach a breaking point.
So you're saying this week or next week we could see a total breakdown of our healthcare system. The governor said she hopes you're wrong. I do too.
I've never wanted to be more wrong in my life.
Right.
But how realistic is it, Doc? I mean,
yes, it's very, very, very realistic. And so, and I'm saying this not to cause panic. I'm really saying it for us to be very clear about what the true risks are. I think we need to take this very, very seriously and be able to act accordingly because we can still do a lot now. Now, in terms of for the hospital, we are, it's very tough to get resources here in Guam, as we all know. And both hospitals have always been running on limited resources. And then you add this surge, and then all of a sudden that's where the break point will come from. Now, if we can slow down the surge and if patients get sick and needing the ICU, but in a more staggered fashion, and where they trickle in more slowly as opposed to being a major surge, then we have a chance to bend but not break. And the break point is really where we will see the actual deaths start really rising very, very fast. And it's because we won't be able to keep up. So the main part here is the staff that in both hospitals that take care of these very, very sick patients. Even though we may have enough ventilators, we may not be able to get them running and have enough staff to man them. And so the rate limiting step really is the manpower that we have. And so that's something that we have to be really have a good understanding of.
Yeah, and I felt like that was part of your presentation that, really opened my eyes, is that it's not, facilities, but we have beds. We just don't have anybody to staff them.
And that was even before
Right.
the
Yeah.
Pandemic.
Yes, exactly.
Doc, can I ask just about the testing here? The latest release says COVID-19 testing is limited to priority groups. We were hearing yesterday that there weren't any tests picked up from the different clinics. And how is this new testing of priority groups going to affect? Is it going to affect results? Because people were asking, hey, we got a lot of negatives last night, and then we see this release and see that there's been a change in you guys' strategy, who you're testing. Can you just maybe unpack that for us?
Yeah, sure. So the thing is that the collection of samples from the clinics so forth, that still can occur, and we are still encouraging the rest of the medical community to do so, especially on patients that you think are likely to have it. And public health is collecting those tests, but they're triaging within the tests themselves. And the tests that they're going to run first are the highest priority tests. And then they're going to they're going to put the rest of those tests on in the backlog, so to speak, the lower priorities. If something changes in those patients, for example, if they get sicker later and they need to go to the hospital, then they rise up into the priority testing list.
So how many?
Right now, oh, go ahead.
No, go ahead. Go ahead.
Oh, so what we're trying to do and prioritize over, especially the next few days, and again, this is also in response to where we with the data that we're seeing in our trajectory. That's why what we really need to do to sort of grease the wheels in terms of trying to maintain GMH and SNU as the COVID hospital and protecting GRMC's patients and all the other non-COVID patients that are trying to move from GMH to GRMC. In order for us to expedite that process, we need to actually know who is COVID positive and who is COVID negative in order to do so. And there are situations where we're having where we have patients who are suspected at GRMC, for example, to have COVID, and it's taking 2 to 3 days to get those tests back. And then we're caring for them, we're putting them in isolation at GRMC, but the reality is that we don't know what we're dealing with, and if that test comes back positive and they're still at GRMC, then we've lost 2 days basically of getting them over to GMH. And then in return, getting somebody else from GMH back to GRMC, because it's a constant swapping because of the limited beds.
Right. And so how many days, Doc, do you think that this priority, limited testing for priority groups is going to take? And is it kind of like we're going to run through everybody at the hospital, ER patients, all the staff, just to kind of get a litmus test of where we are at, right?
Yeah, we would really, and I think what we have to understand is that the recommendations for testing is going to come in different phases. And I'll be honest, it seems like every hour we have to keep pivoting in a certain way, and it seems like every day we're making big changes in what we need to do in terms of prioritizing. But right now, again, because of what we're trying to do to take care of the sickest, that's how we're prioritizing the testing. Now, again, we're also understanding that this is going to be a battle that could go on for months. And with that, and with an influx of more testing capability within that time frame, we will be able to expand the testing more to test particularly the healthcare workers who are exposed, and making sure that they're okay, and that so that we can also limit the exposure within the hospitals itself.
I just wanted clarification because you were mentioning GRMC. So if people are feeling sick and they have flu-like symptoms, they go to the clinic, they're swabbed and waiting test results. They go to GRMC as PUIs and surveillance cases, and then when the test results come back, and if they are positive for COVID, they're sent to GMH.
Yeah, so basically, not just anyone that goes to see their doctor in the clinic or gets seen with flu-like symptoms, they don't. If they are only sent to the hospital if the doctor feels that they actually need hospital level care, and so otherwise, if they seem well enough to go home, they're given very strict orders to home isolate, and they are swabbed, and then that's sent for testing. But we're supposed to keep very close tabs, and public health does this as well. Anytime somebody's swabbed, public health is notified and informed of that person, and so there can be a tracker on them. And if they get worse or if their symptoms change, then the recommendation may be for them to now go to seek care at the hospital. But so just to be clear, not everyone who gets swabbed and gets tested is automatically told to report to one of the hospitals.
Right. Doc, so you mentioned there's going to be a backlog of, let's say I'm feeling sick, I go to American Medical Center or wherever, I get swabbed. You're saying those tests are a backlog. How much of a backlog are we talking about? How many samples are waiting to be run?
Yeah, I don't have that data in front of me. And so I'm not sure, and that changes obviously from day to day. I was at Public Health Lab on Saturday afternoon, and I was looking through their numbers, and what they were seeing was that they basically only had enough tests to test the high. They basically had 3 levels of priority: low, medium, and high, and they're starting to have to tier even the high level ones. And so I'm not sure how long that backlog is going to be, and that hopefully will shorten.
Doc, is this affecting the types of results we're getting? Because I just want to be really careful Here, you gave a great presentation. You raised a lot of red flags. But then people see things like test results released late last night, and they see a lot of negatives, and maybe that thought starts to creep in, like, oh, well, we had fewer cases.
Oh, yeah, that's that. I thought about that last night, and what's actually interesting is that if you look at the projections that we had in terms of comparing to the globe, we were, even with the 2 tests last night, we were spot on. 29 cases was predicted for yesterday. And with those 2, we were at 27 because of the additional positives we got from the day before. So it's a constant, up and down, up and down. And so we cannot make the mistake of thinking that just because we had 2 positive yesterday that we're doing better. Because right now, actually, we're still on the exact same trajectory.
Right. So it would be irresponsible for people to say that, hey, this is a silver lining, or hey, we're looking on the up and up.
Correct, and that's why these testing is a little bit of a double-edged sword, especially this early on, is that we can, because a lower positive rate for the day, which so many factors depend on that, and the limited amount, it can give this sense that things are that we can relax in the precautions when actually it should not give you any comfort at all in terms of relaxing of precautions. And the main point of the presentation is to say that we are still not doing enough.
Right. So let me ask you this, Doc. How is this these new testing strategies, which are being done at a time we don't have enough tests? How much are they? What I'm curious about is if we're doing priority testing, what about those patients out there who are infected, don't know it, asymptomatic, spreading it as we speak? Is that going to get out of control while we're kind of trying to see who at the hospital or the staff has COVID-19?
Yes, absolutely. And so that's, and Chris, you bring up the critical point here, is that everyone has to understand this one very important fact, is that you can start, even though you feel absolutely 100% well, and especially if you're young, you can start being contagious and spreading the virus 2 days before your first symptom, if you even get any symptoms. And so the younger people are the vectors. They're the virus is using younger people as the weapon, as the gun. Basically, the virus is the bullet, but the young people are the guns. That's why seeing pictures on Sunday of people gathering at Jimmy D's, young healthy people. I cringe when I saw that, because they are the ones that are the ones that's spreading the disease, so to speak. So, to put this plainly and simply, what we have to do, and the most important thing we can do, especially for this next week, is to separate our younger people from our older people, from our manuncles, because that combination is the most lethal for our island right now. In many countries, about 0 to 0.1% of those younger than 30 die from the virus. But those older than 65, these countries have seen about 1 out of every 5 or 6 of them that get the virus die from it. So what we need to do right now for an extended period of time is take care of Nana and Tata, Grandma and Grandpa, but from afar. Lots of WhatsApp, FaceTime, Skype, you name it. Even if it's from from a different part of the house. But as long as they're isolated in a different room or section, do not enter the area. Bring them well-cooked food and water in a clean container. Do not hug or kiss them, because you are putting their lives at risk. It does not matter if you yourself are feeling well, because you can be contagious for 2 days even before your first symptom.
I had a question, Doc. You were talking about the breaking point for the Guam Memorial Hospital. What about the Naval Hospital Guam? Say GMH reached its breaking point. What sort of plan or communication have you had with the military in terms of civilians being able to be brought there?
So that's a tricky topic overall, because obviously, as we know, that Navy has their own mission in terms of readiness and defense of the country, but at the same time they do have resources. Personnel resources, particularly their doctors, are some of the most valuable, because a lot of their doctors do moonlight within the community and at both GMH and GRMC. There's currently an order for them to not moonlight and to kind of for them to be isolated and contained for in the event that they're going to need them there at Naval Hospital. But that being said, there is communication in particular amongst the chief medical officers between the three hospitals, and we're communicating frequently. I understand that Captain Young from Naval Hospital has spoken to Dr. Mike Cruz and has offered assistance in terms of other resources like potentially ventilators on loan or things like that of that nature. As the situation seems to need it, but right now that is not the case. But that help has been offered and will be addressed if it comes to that. So it's not that they're putting themselves completely in the dark. They are not. They in fact are trying to reach out and be helpful. But in terms of opening up the gates and starting to send patients there, that is not on the current plan right now. And doing so might there's a chance that we have to always understand risk and benefits, and there may be a lot of risk involved with that as opposed to actual.
For them, benefit would be all ours.
What about, do they provide information to you guys in terms of how many tests they run and whether, their results that they get, like what you guys provide to the public?
The short answer to that is no, not at least to my knowledge. I'm not aware of what they may or may not report to public health, because that's who they will report that to anyway. And so I can't comment on that.
So if they had like a confirmed case, we wouldn't know.
You'd have to check Navy Times maybe or something.
Yeah, I don't know the answer to that. What their protocols are.
Okay, but like I said, if they had a confirmed case, we wouldn't necessarily know. They don't have to report it to the local government.
Yeah, we have to also we have to really appreciate still that mission essential people at Naval Hospital are still civilians as well. There's still some of them in terms of being federal contract workers or just federal employees, and so they live in the community here as well. Mm-hmm. So it's not like their gates are completely impermeable to the rest of Guam, and that communication is still very important. And I know that like with Dr. Thane Hancock from CDC being a very good intermediary in that process, I think is important as well.
Okay, so no, they don't have to report any numbers or anything like that.
I don't know the answer to that, but so I'm not. But I hope they do.
Doc, how confident are you in the governor's new public health emergency extension? And, I know she's tightening up the mandatory social isolation orders. Do you think that that's enough? Are you of the opinion, because you had just said that this very likely will stretch into months? Is every day that we don't go into a major extreme, martial law type lockdown another day that we lose this war against COVID-19?
I am very confident in the governor's plan to extend this emergency declaration. I'm very confident with her plan, and I applaud the efforts to shut down the beaches and public parks. And if it's at the minimum to really help illustrate the seriousness of this. The reality is that, even if we went into martial law, a complete 100% martial law and everything locked down, that still necessarily wouldn't be enough, because we need the public to truly understand what happens even within the household, mm-hmm. and what is necessary within the household. So putting our resources and all that to line the streets with tanks and military trucks is not going to be the solution to this. It's making sure that...
I'll tell you, if I saw a tank outside my house, Doc, I might stay home for the day.
Yeah, but you might start hugging your grandma even.
Yeah.
Right.
And
Doc,
that's the problem.
Right. I don't know if you can talk about this, but we're getting a message here on the Facebook. Is there any information about a potential cluster in Sinania? Do we know anything about this? We haven't heard. Is there anything you can tell us?
In terms of the cluster, I don't know anything more than what's already been published and put out there. And again, it's one of those things. I know people are hungry for a lot of this information, and it makes them feel like they have some control. They know where the threats are and where to move. But the harsh reality is that, especially over these next few days, these clusters, in my opinion, they don't really matter, because we have to assume that it's everywhere, and that the threat is 100% around us, and that the clusters are in front of you, behind you, and to your left and to your right. And so that's the main thing. And so we focus too much on where the threats might be and where they're not, at least in the public sense. Then I think we're losing ground instead of just understanding
And Doc, do you think that it already is everywhere?
I believe it is, and I pray that I'm wrong, but the reality is that I'm very, very afraid that this is that I'm correct in saying that it absolutely is everywhere. It's completely invisible. We don't know who has it definitely, so we must assume that everybody has it, and that we ourselves may also have it, whether or not we're having symptoms.
Dr. Cabrera, I know that you're part of the Governor's Physicians Advisory Group. Could you tell us a little bit more about the decisions behind the home isolation? Because initially we were heard that 9 that were released last Friday were per CDC guidelines, and that it was only temporary. And then so on Monday, when the press conference was held, we heard that there were 20 that were on home isolation. And then we heard just a few minutes ago from Mayor Robert Hoffman that there's this plan that these home isolation patients that don't meet, that their homes are not suitable, would be moved to the Pac Star. Is this? Yeah, can you confirm any of this?
No, I can't confirm any of that. I don't have. I'm not tracking that information on a minute-to-minute basis. But who is, of course, is public health, and I got to say that their team. I've seen what their tracker process, and it's actually quite impressive, and how they can actually follow along very closely.
Well, Dr. Hoa Nguyen, he's also part of the Physicians Advisory Group, and we also spoke with him on Saturday, I think it was. Chris, you spoke with him?
Yeah, and he was very alarmed. He said that, these patients in home isolation will infect their family members.
Yeah, I'm sorry, I missed a part there. Which physician?
Dr. Nguyen. Hoa Nguyen.
Okay, yeah, and so that again just emphasizes the whole point that we are trying to. Public health is trying to do what they can based on what they know and with the methods that have been proven in other pandemics. But Dr. Wen's concern is correct, and it's in line with what our immediate concern is right now, especially for this next week. Again, is that there may be a potential to infect others, but public health is also trying to ensure that there's the right understanding of what the home environment is and what can be done to protect the others within the home.
So public health can make the decisions without seeking advice from the Physicians Advisory Group of the Governor?
In which
in terms of deciding, hey, we're going to home isolate, or we're not going to home isolate, or we're going to put them up at a hotel, or
yeah. So they are definitely have the liberty to make the decisions based on their actual protocol. Now the advisory council or group that's been put together is more of a way to look at some of the broader picture of where things are right now with COVID, and then also where and trying to again get ahead of things, and Wayne Gretzky, his famous quote, it's important, you go to where the puck's going to be, not where it is. And so that's what the group is trying to actually focus on and trying to get ahead of things, and so that we can address it, and do things on a much global preventative measure.
Doc, let me ask you something. In a perfect world, right, when these patients are under home isolation, they get told what to do, public health calls on them, are we leaving too much to these patients? Are we leaving, is there too much room for human error?
I think that human error is human nature, and I think that's part of that. But at the same time, again, I just want to emphasize that's why it makes it even more important that these precautions are taken by every single person who can fog a mirror here on Guam.
Mm-hmm. Are you aware of any of the test results that are confirmed positive, if any of them were from the quarantine facilities?
I don't know that information, and I don't, not to my knowledge. Okay. But I don't know that detail to be at all, so I can't confirm it nor deny it.
Okay, Doc, how many days do you think it'll take us to kind of run through the priority group for testing, which consists of, according to the release here, hospitalized and emergency room patients with COVID-19 symptoms, people with chronic diseases and COVID-19 symptoms, healthcare workers and first responders with COVID-19 symptoms, and older people with symptoms of COVID-19?
Yeah, that's a very tough question to answer because there's a tremendous amount of factors that go into play. Public health is right now they're doing multiple shifts to be able to run this test. The public health lab, I should say, are doing multiple shifts to be able to run as many tests as they can. And even with that, we have to understand that these tests are some of the most complicated tests that are done in any clinical lab setting, and it's called a PCR type PCR test. And because of that, there's a very stringent quality control measures that have to occur. And if any of that is slightly off, then the test results are going to be invalidated, and that we can't trust it at all, and they have to be repeated. And so that's just the nature. That's nothing to do with anybody's competence or anything like that. That this is purely just the nature of the test itself.
Right. So, Doc, that being said, let me ask you, you had said that there's a backlog of tests from these private clinics. Are those test samples being stored in a way that's going to preserve the integrity of those samples?
Oh, absolutely. There's a protocol for how to store them, including deep freezing them, and then they can be run again. I don't quote me on this entirely, but from my experience, months to even years later.
I see.
I'm wondering if there's any way you could push for in the Joint Information Center releases, we could have like a number that says, well, these are the cases that are on backlog. You know what I mean?
I see.
So we can we know.
Yeah.
Kind of get a gauge.
And I think that the maybe the number, at least for me, that I think is important for not just myself to be completely aware of, but also for the public, is also in particular those priority cases that are backlogged.
Mm-hmm.
I think that's the one that's really, really important.
Right, yeah. And so this is what you guys are doing. This is for the next few days, the only people who are going to be tested are people who fall into the category of priority groups.
Yep.
Okay.
But people can still go to their clinics if they're feeling bad, and they can be swabbed.
Yeah, and I highly recommend that everybody, if you're feeling just mild symptoms, that you call ahead to your clinic or to the hotline public health, and they can actually guide you and be able to help determine whether or not you should come into the clinic and be seen, or you should go straight to the hospital. Or if you should just stay home and take the precautions there, because again, coming to the clinic is exposing yourself to the public, and you're exposing the other healthcare workers as well. So we have to be extremely mindful of that, and it's not one of those things where like just that like anything else in life, even going for a test has risk itself, because every time that a healthcare worker has to test you, they use up their personal protective equipment, their protection, in order to do that test, and that is a valuable commodity right now. And so if we can preserve our PPEs, our protective equipment, as much as we can, and if doing limited testing for those that really need it can help in that process, then that's something that we have to be extremely mindful as well. So the short answer to that is that if you can, please call ahead first, and to help determine the necessity of you needing to come in, and then go from there.
What advice do you have for people that are following the order? They're staying home. What tips do you have for them to stay healthy?
Yeah, so one of the things that I was thinking about this, and during the press conference yesterday, I used my own mother as an example, and I hope I haven't talked to her since that press conference, so I hope she doesn't mind. But the key thing is that if we isolate them and we ask them to stay in a particular section of the house, or even within just their room, there's risk of that as well, in terms of them. We don't want them to just be laying in bed all day and then they develop complications because of that. God forbid they end up having a blood clot in their leg. But so getting up and walking and going to the bathroom and being mobile within the home is extremely important as well. But again, kind of just understanding, the boundaries that are important, and being able to disinfect within the house is extremely important. Doorknobs, light switches, and these are very, very important measures that everyone should be taking.
Mm-hmm.
Doc, do you have the latest information on how long the virus can survive on surfaces? Is that something that is rapidly evolving?
Yeah, it is, and there's we have to be very careful with these studies that are put out because a lot of them are done under controlled conditions, as in they're not like actually what's necessary in the environment. And it's in a lab. They aerosolize the virus, and they look at how long it is on cotton versus plastic or steel counter, and then all of a sudden in those conditions, it seems like it can stay alive for a long time, like days and days. So that's under those conditions that exist. But I think the consensus amongst most of the medical community is that it can stay alive for around 24 hours on surfaces. And so that's the one thing. That's something that we have to just keep that number in mind. So something that you touched yesterday could still have the virus, and if somebody else touched that same item and then didn't wash their hands and touch their eyes or their nose or their mouth, and that could be a way of transmitting the disease. So please be very mindful of that fact, and that you could get the disease from somebody who is not even in the room anymore.
Mm-hmm.
Wow, Doc. I saw something on it was Facebook, maybe even Twitter. Italy. There was a couple planes of doctors from Cuba that went to Italy to kind of help out. You mentioned during your presentation, obviously the biggest key to our healthcare crisis is a staff shortage. So have we made any, contingency plans to kind of fold in any? I mean, Lord knows everyone needs their medical personnel, but is there anyone that we're thinking could maybe lend us a helping hand should things get as bad as you think they're going to get?
Yeah, absolutely, and we're very, very fortunate. And this is the things where we have to count our blessings. This is the time we definitely should count our blessings. And there's a lot of them that actually exist here on Guam right now. And the examples are, if we're talking about physicians, there are a number of physicians here on Guam that went to medical school, like in the Philippines, for example, but have not gone through the full licensing process and residency requirements to be able to have a U.S. license to practice. But they have the knowledge base. They still work in the healthcare system in other roles, and so they may be somebody that could be important, as we go through this and this process. And so that list has already been compiled, and there is consideration of giving them emergency temporary, license, I guess, of in order to practice medicine if the situation calls for that. The same thing can be for nurses as well. Those who are have not yet taken their NCLEX, but they have the training. They could potentially become helpful. But the reality is that them becoming helpful is more on the back side, because right now the front side are the critical care patients that where their lives are at risk, and you can't just take just any doctor and to take care of these the sickest people on Guam. And so we're fortunate we have a number of critical care doctors overall on the island to be helpful for this, and that includes both in the ICU and the emergency department. A lot of our internal medicine physicians on the island are also, they have the ability to take care of critical care patients and have privileges within the ICU. I'm fortunate to be one of them as well. I still have privileges at both hospitals as well. But we are very much, it's not even a question if necessary. We're going to grant emergency privileges between both hospitals if it comes to that, in terms of ensuring that there's adequate staffing on both sides to the best that we can.
All right. You going to be at the 1 o'clock press conference?
I'm being told to be, so I guess I will be.
Any heads up on what is going to be discussed, Doc?
No, I think a lot of what your questions that you had this morning in particular, I think with the testing, is my understanding is what's going to be discussed, and getting a good understanding of that. But other than that, I'm not sure what else is on the agenda.
All right. Well, thank you so much.
Yeah, definitely.
We'll see you at 1.
Thank you. God bless.
Okay.
Stay clean.
Wash your hands.
Yes, thank you.
Okay.
Stay home.
Right. Yeah, stay home. 7:42. Wow, what an interview! Pretty much 40 minutes of Dr. Felix Cabrera.
Lots of good information.
Very sobering. Mm-hmm. I mean,
reality.
Anybody who thought that because he's in the Physicians Advisory Group, he's advising the governor that he was going to somehow sugarcoat info. Well, you have another thing coming. Very, very alarming. He's the chief advisor to the governor, I guess. I mean,
I don't know if he's the
he's
chief.
saying
He's
that,
part of the
right?
governor's
He is.
physician's
Yeah, I mean,
advisory group. The chief
he's
is
chiefly enough
Dr.
to call
Mike
the
Cruz.
radio, right? Yeah. But I mean, saying that this is going to stretch into months, and man, I feel for our people because
And the fact that he thinks that it's here.
yeah,
I mean,
and
it's more.
it's
There's more.
widespread. Yeah, I mean, those were his words. Again, a lot of information. We're only less than halfway done with the show, so if you can share the broadcast with your family, get them to watch it. What we're trying to do, and here at KUAM, we're also under COVID-19 measures. We've done things. We've tooled back how we cover events, but we're still trying to get you guys all the information. So what we do is we take all the interviews from the show and then kind of like cut them up and put them out there in a format that is hopefully more easily digestible for you guys.
And we've limited the number of people that can come into our building.
Right.
A lot of the reporters are working from home, but they're still gathering the information, conducting interviews from home. As you saw with Adriana Cotero, she had that interview with John Fernandez, and that was all done via teleconferencing, and the same with Nestor Lecanto. So we're still on top of it. We're still getting the very latest information out to you. Chris and I, for the most part, that come in the mornings to do the radio show and stream live. But we encourage you, if you want to know what's happening, once we know, you'll know. Download our mobile news app. Go to KUAM.com. Check us out on Instagram and Twitter. Jason, you know all of the ways to
Right.
get our news.
Yeah, just check us out at any social media platform at KUAM News. We're gonna do this as long as we can. I mean, I like the term you used, Chris, sobering. And we've had to make some very big decisions here, and we've had to accept some very big realities too. About
Like Kings doesn't open until 6:15. That's one of the.
Yeah, it was open when I was coming to work last week, right?
Yeah.
And so this morning I was like, oh man, now I really needed the toast. I always ask him to get me toast.
Yeah.
I really needed it this morning, but it was closed.
Yeah, but we are doing our very best, and this is and they say in the military, it's like why do you train so hard so that we can be our very best?
We train for this, Jay.
Yeah, so that we can be our best when our community is at its worst. And I think at this point, we don't want to wax hyperbolic too much and everything like that, but people need information, and we're really doing as best a job we can to get that out in as many different platforms. So yeah, like Sabrina was saying, check us out at any social media platform. We're on Instagram, we're on YouTube, we're on Facebook, we're on Twitter at KUAM News. You want to download our app. We've got our stories there as soon as we publish it. Also, KUAM.com, and you can browse KUAM.com on your mobile browser too. So constantly refresh it. And we're not just looking for page views. We want to get you guys the information because there's a lot of stuff coming out right now, and it's our job to parse through that, make sense of it, put it in some palatable form, and then get it out, to you guys. And
all while having less than 10 people in the building total.
Yeah. Okay. I do want to address something since you guys have given me like a little bit of airtime right
Yeah.
here.
Should I just turn off your mic? Are you good? Is it good?
No,
Go
that's
for
Andy's
it.
thing. Okay, so there have been some comments. I know in the comment stream on Facebook, some people were saying, have you guys actually done the math, and has there been an official percentage of infection calculated? We were reporting that like the other day, just based on simple, the number of reported positive cases divided by the number of tests. As of a couple days ago, it was 14%. Basically it's simple arithmetic to do that.
Right, but the thing with that number is that if we're really fine-tuning the criteria for testing people, I think that
Right.
we already have a kind of a predisposition for more positive results.
Right, and because of the limited number of test kits we have, that would be the case because GovGuam is doing what it can to preserve those test
It
kits.
seems pretty hard to get tested for COVID-19 unless
Yeah.
you're in one of these priority groups.
Yeah, so what we want to tell people not to do is to take that number and completely freak out about it, and go all over your own social media and tell people like, well, look at how high our percentage is and everything like that. GovGuam's doing what it can with what it has.
Mm-hmm.
And we're also going to make sense of those numbers and tell you, okay, this is what it is and this is what it means, because that's the most important part right now.
More importantly, we're going to get people like Dr. Akimoto, Dr. Shea, Dr. Hoa, Dr. Felix Cabrera to come on. It's really leave it to the experts and let them, say what they got to say, and then we're just going to package it and get it out to you guys.
Right, because I'm not an expert. I'm not a doctor. Okay.
I played doctor a couple times. Hey, our number is
That's a completely different live stream right there.
That's after dark.
Yeah.
TMI.
You're right. Anyway, so 637-0094 is our number. 747 Bree. So that press conference going on at 1 o'clock, right?
That's what I was told. 1 o'clock today. We'll be on Zoom, and so we'll
You'll be able to watch out on our properties as well.
Right, we'll have that live.
So we had a comment here from Liz, or where was that at? Yeah, Liz writes in, the Zoom interviews are very crackly, and it's always breaking up. Why is the government using that? Is that the Zoom, Jay? This is kind of up your alley. Are there other apps like Zoom that are maybe,
Yeah,
Zoom
is actually in tech industry. It's very renowned for its ability to deliver very high quality video, and it scales very, very well. Meaning, the more people you have watching video, that imposes a lot of heavy lifting on the server. Zoom does a really, really good job of delivering, high fidelity, high definition video with really good audio quality there. But you're only as good as your internet connection. And okay, one pro tip for all you tech people out there. Even some people say it on our stream from time to time. If you're watching us or listening to us on a mobile device and you're saying, oh, I couldn't hear Dr. Cabrera that good, or Chris, why is your voice so low? Okay. Pro tip for you guys on a phone, right? Regardless of whether you have an Android or an iPhone or an iPad, there's 3 volume settings you want to know, right? There's your ringtone, your master volume setting, and your media volume setting. Best case scenario, if you have a problem like, with the audio being a little bit low, just go into your settings and max out everything. The ringtone obviously is the one you want to minimize, because if your phone goes off, you don't want to freak people out. But media setting and master setting, just put those all the way up. I guarantee everybody's going to sound crystal clear. We will be 5 by 5 if you do that.
There are 3 volumes on the phone?
I know.
Yeah.
Oh, so vibrate on ring, vibrate on silent, and then...
Yay!
Am I right?
Yep.
Okay.
And Sabrina's got an iPhone, but yeah.
It's pretty cracked.
But I think my 5-year-old could have told us this.
But to Liz's question, about Zoom being crackly and everything like that, I mean, we've got a really good connection and we're putting it out. Granted, a lot of people are doing this over wireless devices, so if there's a lot of Wi-Fi in the room, that is the nature of video conferencing over the internet. It may not be, to use like a local term, it may not be cherry the whole time. It is gonna sound good though. I mean, you may have pixelation every once in a while, but the signal will stay online.
That's so awkward to hear you say that.
I know.
After you said max hyperbolic.
Yeah.
I've been working 21 years to be able to say that.
Right. Okay. Thank you.
And now I'm done.
You're done now? All right. Apparently. Hey, 7:49. We're going to take a break containing COVID, the KUAM News Takeover, Guam's favorite.
I have no idea what he was saying.
I-94. Good morning.
Wendy's is open for business and taking extra steps.
It's day 5 of quarantine. Just trying to soak up some of this late day sun, get some vitamin D. It's good for you. So is vitamin C. According to all the research I've done, if you can get some, get some. We're here in quarantine. Not much has changed. I want to thank everyone who's called and reached out and texted to check up on us here in quarantine. It's going. They feed us 3 meals a day. The food truck Guam and their crew has been very good about keeping us nourished and meeting people's dietary needs. At least in my case, I encourage anyone who has any dietary needs to reach out to them. Other than that, not much going on. We still get temperature checks, but now it's once a day. If you continue to answer no to the questionnaire, they will just come in the mornings and give you a temperature check. I've been consistently reading about 96.5 temperature, so I feel good. Can't wait to go home, but still, I mean, this thing doesn't show itself right away, so symptoms can come up later. Pray to God it doesn't show up for anyone here in quarantine or anyone else on island. Messages still stay home. We had a spike of 15 people just yesterday, and that's expected to rise. If you have been following the trend, what's been happening around the world, I have been following what's been happening in Manila and other countries where I was staying. That's just the beginning. If those people, 15 people went out and were socializing and not being safe, then they probably infected people. Remember, it's asymptomatic. They're not going to show any signs of this virus. So please stay home. For the love of your family, stay home. That's all you got to do, and so we can figure this out. If we overwhelm the healthcare system, then God help us. That's all you can do is stay home. That's all we were asked to do is stay home. Stop fighting the system. Stop talking about martial law. It's not. It's just for the good of our island and our people. Stay home. We're here another 9 days. You guys can do it. I'm doing it here with everyone else in quarantine. Like I said again, I know people said it's hard to stay home. If you have to go out, be safe, sanitize, limit your movements, come home, stay home, wash your clothes, don't bring it into the house. Peace.
DOL Director Dave De La Sola says the $100 million dislocated worker grant is being converted to a temporary recovery work grant in which laid-off employees will be paid to help with the recovery.
Once this quarantine has been lifted and we're starting to reach some normalcy, then we will take some of these people who are temporarily laid off and start to put them to work. What we're going to do is put them out to the quarantine sites to help clean up, help prepare meals, help the schools, the hospitals, and the mayors all clean up the facilities and get them ready for use.
But that's not all. De La Sola says GovGuam will also be applying for the Disaster Unemployment Assistance Program, which could pay qualified displaced employees an average of $500 to $600 a week. He says they've begun seeking information from employers and their employees that's needed for the federal grant application.
We already started the template. We are starting the application. And once that declaration comes in, that'll give us information on what to put in that application exactly. But usually, if we are awarded, which I'm sure we will be, it'll be a weekly check going out to all the people.
Guam DOL is still waiting on the grant details from the U.S. Labor Department. They'll be soliciting information from employers and employees. The website is rapidresponse@dol.guam.gov. For Guam's News Network, I'm Nestor Lecanto.
Akin Santos Stan Martina si Tan Rosa di namin mas
Containing COVID, the K-Web News takeover. Yes, it's still Mess Chamorro out there. Anya Chamorro, year of the Chamorro. 7:57. So much out there on social media, and one of the things that we were able to track down was a poem that I saw last night on Ann Hattori's Facebook page, and this poem was about the first fatality, a COVID-19 related fatality on Guam, and we're going to get to that, Bree. But I just wanted to bring up a relative of. Let's just get Yolanda. Good morning, Yolanda.
Half a day.
If you could just confirm that the a woman who passed from the COVID-19 was Doreen Jesus, correct?
Yes, she was my auntie Doreen.
And
first of all, our condolences. And I can't even imagine how difficult this has been for you guys. Yoli, could you take us just back to when the family first found out that Auntie Doring had contracted COVID-19?
We kind of left that when we found it out. I'm so sorry. It's just we heard like a lot of things on the media about this happening and all the speculation with family coming back from off island, and just knowing that we had family coming back from off island and that she was also in the hospital. We kind of put it together, but when we actually realized was when also in WhatsApp someone actually mentioned her name, and that kind of, we never really were officially told, it was all through social media. And we tried contacting her daughter, but it was really hard to get in touch with her. So it was only about maybe on Sunday or Saturday when last week when we actually put it together. But it was never really confirmed to us until later in the week.
I'm sorry, but how long was she in the hospital?
From what I can recall, is she was in the hospital on Saturday. Last week Saturday.
Okay. For more than a week, right?
Yeah.
Mm-hmm. And a majority of her family lives off island?
The majority of her immediate family, her granddaughters, her grandson, her but her daughter is on island, and one of her sons is also off island. Mm-hmm. But she only has one of her children on island.
I see.
Can you tell us about your Auntie Doring? Because, there was a poem that Ann Hattori had wrote. I'm going to read it out on Facebook, but to me it really kind of captured a lot of things, and that, we didn't know her name. I mean, well, we did. We just didn't, have it confirmed with any of the family. But I didn't like how she just became a statistic. You know what I mean? And this is a person who apparently, in talking to people, touched so many people's lives, and all she was known to us was as somebody who died of COVID-19.
Right. Yeah. Ann Hattori is actually my cousin, so this is someone in my family, and I know she must have been really frustrated, and needed to humanize our auntie, because I understand why no one released her name. We didn't even talk about her until we got permission from Lisa, out of respect for her privacy and, for all that. But just reading some of the really terrible comments that are made about, assuming how she got it, and one of my nieces came back from Japan, and can you imagine if she thought that she was the one who gave it to her grandma, and all the speculation with how she got it. I mean, I understand it's a pandemic and people want to know, but just wait for the officials to say it. Don't be like one of the so-called keyboard warriors and become automatically, you wake up one day and wow, now I'm a doctor, so now I'm a reporter, and now I'm a Homeland Security advisor, and I know exactly how she got it. That's really hard for the family to read. But like everyone on Guam, we've lost someone, so everyone knows how that feels. Now add to that the fact that my cousin was not able to be with her mom when it happened.
Yoli, was this because of the isolation measures?
Yes, because of the isolation. My auntie was alone, and in Guam, when we know someone is passing, we all go to the hospital or to the home. If it's happening at home, we're all there to show our support. And even now, my family, we can't get together. And although everybody knows what it's like to lose somebody in their family, adding the fact that we can't even get together, and it's just really hard. And I wish people would be nicer about this online, because she has so many people who love her, and I just want to shout at everyone to just leave her alone. I'm sorry, it's hard to talk about it right now.
If you could just share, despite all the comments, just something that you remember her for. What type of person was she?
Yeah, she had a really beautiful voice. She did so much to add to the beauty of our culture. She was one of our aunties who was not shy to get on stage and be proud of our culture and sing and dance. But her voice was so pretty. I mean, like I wrote in my tribute to her, her voice was like sing-song, you know what I mean? It was gentle, and when it had to be firm, her voice was still pretty. Even if she was getting upset at you, her voice was still pretty. So that's what I remember of my auntie. She always had, in her younger days, she had her guitar with her, and she would sing. She sang in the choir at church. She was very musical. She could play piano, and she taught a lot of my cousins and me the Chamorro songs at Christmas and the hymns for Mass. It was all Auntie Doring in the choir all the time. Auntie Doring in the choir at Mass. And I believe it was just last year that she actually stopped being a member of the choir because of her declining health. But she was such a wonderful person, and she taught her kids. Honestly, she taught them, before anybody asks you to help, you ask them what they need. My cousin, if we're having a party or a get-together, she would come over to the house and start working. I'm like, oh, Lise, don't worry about it. We didn't even start. But, that was the way Auntie Doring taught her, is you don't wait to be asked to help. You go and you help. And it just breaks my heart, and the rest of my cousins, too, that now that it's her turn to need our help, we can't. We can only just pray. But I wish people had, met Auntie Doring if they haven't met her. I mean, if they never had met her. She was really a beautiful person. And it's her voice. She had a very, very beautiful voice.
One of my friends, Father Eric, was telling me that Auntie Doring used to play organ in the parish in Saipan.
Oh yes, she did. She did, so, because she lived in Saipan for a while too. She was really good friends with Polly Eric.
Right.
Yeah.
And he had some very, very nice things to say about Auntie Doring. But again, like we said, we didn't want to come out and announce anything out of respect for the family. And, we'd heard that Lisa was coming back to Guam. And so, you guys weren't told by public health, anything about your auntie's condition, or was that because maybe technically Lisa was the next of kin and then she was the one that had to be notified, or
I really don't know. Maybe for me, public health never called me because I hadn't had any contact with Auntie Doring. Maybe they're just calling the people who had direct contact with her. I can't say why they didn't call me or the rest of the family. I don't know who they called in the family. You know what I'm saying?
And what are we doing about rosaries? Obviously, many people on this island are dealing with the death of loved ones, and they're having to get creative. What is the family doing in terms of offering rosaries?
Okay, so I know that Lise is probably having her private rosaries with her kids via telephone or Zoom. Mm-hmm. But do you know Glenn Lujan from Different? Of course you know Glenn.
Right, yeah.
Yeah, so each night we've been praying a rosary at 8 p.m. every night since even before she passed away. I was having a really hard time last week, Tuesday, and I asked him, I said, Glenny, hey, do you think we can be praying the rosary? And so he didn't even hesitate. So that's what we've been doing for, not just for her, but for everybody on Guam and all the people who are sick and all the healthcare workers and everybody, just to be safe. We've been praying a rosary at 8 p.m. So tonight he does Facebook Live and he makes it public. And we're going to mention Auntie Doring tonight. Now that we have Lisa's permission to actually say her name in the intention, we'll go ahead and start saying that.
Okay.
What about funeral plans? We don't, I spoke with Archbishop last week. I know they're trying to keep the funerals small. You mentioned not being able to gather. One of the ways that we grieve our loved ones is by coming together. Without being able to do that, how are you guys planning the funeral? Is that even in the picture yet?
It's not even in the picture yet, and that's the wonderful thing that in our culture, right? Rosaries are not just for our deceased, it's for the family to come together. And right now, Lise is planning things, but I don't know when they're for. But I know we have to listen to the advice of the governor to keep our group small. So we can't just have a rosary of 50 because that's probably just my mom's side of the family or half of it, So I know that within 24 hours of her death, the policy was that she had to be either buried or cremated, and so I know her cremation took place already. But I think maybe we might just have to wait for all of this to end, the pandemic and the advisories. Once they're lifted, once the advisories to stay away from each other is lifted, we will most likely hear what Lisa has planned, because Auntie Doring's life deserves to be celebrated in a memorial. So I don't know if she and her immediate family are just going to have a private burial of her ashes, or I don't know. I just don't know any of that yet.
Yoli, we know that you weren't able to see Auntie Doring, during her last days after she passed. Was the family given an opportunity to say goodbye to her?
No. No, we were not. Yeah.
Yoli, we're going to read this poem from Anne again, and if you could, you got my number. I'll shoot it over to you. Send us the link for the rosary. We want to get that out, and I know we can't come together in person, and I think a lot of times we forget that the rosaries aren't always for the dead. A lot of times they're for the living, right?
Yes, exactly.
Yeah, so we want to definitely get that out and share that message, and we thank you for reaching out to us. I know this is a tough time for you guys, but really, again, like you said in the beginning, we wanted to share with the listeners around the island that the first COVID-19 fatality wasn't just a statistic.
Right. Thank you so much.
Thanks, Yoli.
Okay, thank you.
You be safe, and you holler if there's anything we can do.
Okay, thank you.
Okay. Well, there you go. Wow, that I don't even know what to say, Bree.
I don't either. I think we should take a moment of silence.
Okay. And so this moment of silence, if you guys are just joining the show, that was Yoli Tenorio Palarca. She's a niece of Adoring Jesus. The family, through social media posts and through contacting us, has confirmed that Auntie Doring Jesus was the first COVID-19 related fatality on Guam. And as you heard there, the family having a very hard time. They weren't able to see her because of the isolation efforts, weren't able to say goodbye to her after she passed.
And they had to cremate.
And they've already cremated her. And wow.
When things are calmed down, hopefully they'll be able to hold a memorial service. But for now, they're holding rosaries on Facebook Live with our friend Glenn Lujan. And so those rosaries are at 8 o'clock on Facebook Live.
And we're going to try and get that link for you guys. I wanted to play this song. We had him on yesterday, Joe Guam. And, there's a bunch of different artists who are doing live things. CJ, was one of our KUAM family here. He did a cover of Bob Marley, Three Little Birds. So we're going to try and play that in a little bit. But we're going to do this moment of silence and follow it with Joe Guam right here in Containing COVID, the KUAM News takeover of I-94.
Times have changed and things are strange and we are so confused. Lives matter, but some are forced to choose. But keep your head up, pour your heart out. Yeah, we gotta believe that if we stand together, we'll make it through anything. It'll be okay. If we're living for each other, take it day by day. Our color doesn't matter. It's bigger than you and greater than me. We're doing this for humanity. Put your faith in one another. We'll find a way. Don't give up. Give it your best. It's okay to be afraid. Our lives have changed so much since yesterday. We can do our part to fill our hearts with love and happiness. The sun will always rise and shine again. It'll be okay if we're living for each other. Take it day by day. Our color doesn't matter. It's bigger than you and greater than me. We're doing this for humanity. Put your faith in one another. We'll be okay. faith in one another, we'll find a way. It's bigger than you and greater than me. We're doing this for humanity. Put your faith in one another, we'll find a way. It's bigger than you and greater than me. We're doing this for humanity. Put your faith in one another, we'll find a way.
Why pay full price? We'll help you save. Check out KOMD.
Like many in her field, University of Guam Dean of Nursing Margaret Hattori Uchima is concerned about just how stretched thin Guam's healthcare professionals are. Uchima says these critical shortages existed long before COVID-19 started making headlines nationally and locally.
We've been crying for help for GMH for years. This is not anything new.
Yeah.
And so we haven't bolstered that system. We've always had a nursing shortage. We have a physician shortage.
Uchima says the Guam Board of Nurse Examiners, through the governor's public health emergency declaration, has been able to do more to help recruit crucial positions. She adds that nurses from around the island, including school nurses, have been activated as well. So if you think you can help, if you have any sort of medical background, you are needed.
We have had nurses that have a Philippine license that didn't get a U.S. one yet. And they can get a temporary Guam license if they meet certain criteria.
She also said retired nurses have reached out to help, and Uchima saying at this point any and all volunteers are needed, even for something as simple as answering phone calls. And while nurses, doctors, and medical staff are on the front lines of the COVID-19 battle, Uchima said it's good to know they aren't alone in that fight.
I have people texting me day and night saying, what can I do to help? I have people right now getting food for nurses. All weekend we've been trying to make sure that the people on the front, have the supplies and the food. So, it's early in the game, Chris.
Uchima said she has been touched so deeply by Guam's generous nature, and it couldn't come.
DOL Director Dave De La Sola says the $100 million dislocated worker grant is being converted to a temporary recovery work grant in which laid-off employees will be paid to help with the recovery.
Once this quarantine has been lifted and we're starting to reach some normalcy, then we will take some of these people who are temporarily laid off and start to put them to work. What we're going to do is put them out to the quarantine sites to help clean up, help prepare meals, help the schools, the hospitals, and the mayors all clean up the facilities and get them.
Good morning, Guam. I'd like to thank Yolanda Palarca, the relative of Doring Jesus, who tragically passed from COVID-19 related symptoms.
They're having rosaries via Facebook Live on Glenn Lujan's Facebook page. That's live nightly at 8 p.m. So please join and send your prayers.
Yeah, and our deepest condolences. It kind of got wind of this officially last night when I was strolling Facebook. I just wanted to read this poem here. Let me get that. Where are you? Oh, yes. By Ann Hattori. This was posted on her Facebook here. It reads, to Auntie Doring, who taught us to do the hustle as long as we didn't skip choir practice. Guam's first COVID-19 related death, a 60-year-old woman with underlying medical issues. Defined by COVID-19, by underlying medical issues, by her age, her diabetes, her dialysis. Not by her kick-ass persona, her mean guitar, her beautiful voice. The 68-year-old woman arrived at GMH with fever, chills, and shortness of breath. She had no travel history. Defined by COVID-19, by symptoms now deadly, and itineraries now errant. Not for her exuberance, her loud laugh, her rosy cheeks, her gusto for life, but we will remember her warmth, her heart, not the coldness of this newsprint. And that kind of, why we reached out to the family this morning, because I really felt like, and Yolanda said, people they're not thinking when they're writing stuff on Facebook, when they're writing things in Facebook comments. You guys should know better, really. This is Guam. We all know each other. When you're typing about somebody who died locally, their family members are going to see those things.
Right. And this family, they didn't get a chance to say goodbye. Because of the protocols that are in place. Doring was cremated, and they plan on holding a memorial service for her, somewhere down the line in the future because of current guidelines that are in place. And for now, as I mentioned earlier, they're going to be having rosaries on Facebook Live on Glenn Lujan's Facebook page.
Okay, and I just wanted to say, for Glenn and for Yoli and for everybody who jumped in, they were saying that, a lot of the comments were maybe, definitely like very insensitive to what their family was going through. But the comments that we got, Chris, when you and Sabrina were talking to Yoli, we've been talking about how we've been streaming like the churches, their daily mass and the Sunday service and everything, and it really is a online virtual translation of what you would be like if you were in mass, where the responsorial psalm and people are typing amen, and they said, people are trying to make the sign of peace to each other. It was almost like when you were talking to Yoli, people were sending their comments unbelievably sympathetic, offering their condolences, offering their prayers, putting the heart emoji and everything like that. And it really was like if we were in a proper memorial service, people lining up to, give the family their condolences, to make the tsunsuli and, to do everything in our culture. Because, that's who we are as Guamanians. We don't leave our people behind. And so if people just heard about this story maybe second or third hand and they were just asking questions and comments, which, may have rubbed, the family the wrong way, considering the situation, the people that were actually giving the comments while she was on, overwhelmingly supportive, sympathetic, offering, their help and everything. So thank you guys. I mean, that really helped, the family during, as you said, when you first started interviewing her, Chris, like an unimaginable just time for them, for the family.
What were some of those comments? I have noticed that you have your phone.
Yeah, we popped them up. A lot of people were saying, quite simply, they were putting like, the prayer emoji. They were saying condolences to your family, like I'm so sorry for your loss. There were so many of them. We popped many of them up on screen when you guys were talking.
Right.
But yeah, I said, again, like you would be when you were in church and everything. People are using Facebook now to actually participate when we're unable to physically because of social distancing.
Mm-hmm. And you mentioned about masses that we're streaming online. Those are at 12:10, correct?
Yeah. So the daily mass is being held. It's and for those of you who may not be familiar with the actual venue, that is from the Cathedral Basilica. It's just not in the main sanctuary. It's off in the chapel. Like I had no idea about that chapel until like my own father's when my dad passed 2 years ago. The chapel on the side. It's a lovely facility, and then they have that in there. So it's very intimate. It's very nice, and you can participate in like a 20-minute mass. And then on Sunday, so that's every day at 12:10. We share the Archdiocese of Agaña's Facebook post, and you should follow them because they have daily devotionals. They offer passages of scripture that you can follow anytime. There are messages from various members of clergy to uplift you, to say like, if you want to do your own Bible readings to give you some inner peace. They do a lot of that. So the guys at the Archdiocese and women are doing a fantastic job with that. So we share that weekdays at 12:10, and then on Sundays, the 9:30 Sunday Mass is you can do that. And I know it's okay. That's primarily, or that's exclusively from the Catholic perspective. There are other churches on Guam. I know, like we've been talking to some of our colleagues here that go to born-again Christian churches or Baptist churches, or my best friend Will runs the IT for the Palauan Evangelical Church of Guam, and they do all of their sermons exclusively through Facebook. So people are getting very creative because they know more than ever people are looking to faith now, for guidance, for inspiration, for hope, and for meaning. And so like, regardless of which church you go to, or if you've never been to church at all and you're looking for some sort of message to to help calm you and to give you peace. There are a lot of these things going on Facebook right now, and we're going to have a story up later on today. We're going to show you how, whatever you believe in, there is a way when you can turn to social media to help you find, some sort of, and participate in a religious service of some sort.
Right, and we heard it from Tomas up in Saipan. A lot of the churches there have taken everything online.
Yeah.
So
again, that's 12:10 p.m. Weekdays on our Facebook page, where you can find the live stream of the Mass. And again,
and you were just asking me, Bree, in chat. We're going to bring up, Father Ron Richards, right?
Mm-hmm.
His homily from the other day, unbelievable, so touching. But even Father, when he was at the pulpit, he even said, he goes, this is kind of awkward because I'm used to, preaching before the congregation, and he goes, it's me and it's the lector. And there's the guy behind the camera, and he goes, that's basically the only people in church. And, when we had His Excellency on, last Friday, Archbishop Michael Burns, he even said, he was very generous, and Chris asked him to lead us in prayer, which he did. And everybody, again, over Facebook was praying along with him. And I remember his distinct words was, he goes, oh God, please help us through these strange times. And I thought, for someone as educated and worldly as the Archbishop is, and, we've all had the chance to have discussions with him and interview him, he used the word strange, which I thought was very, very fitting.
Twice.
Yeah.
Yeah.
To just say, it's just really, really unprecedented times we live in these days.
All right. Well, there you go. Jason Salas, he doesn't get out much.
But we do have a bit of positive news if you guys want.
Right. Yeah. So this is coming from Dave Delgado, KUAM Sports. What do you got?
Okay. So Dave is working on covering various angles of sports on Guam, but he said that the members of the Guam Football Association have donated all of their N95 face masks along with 40 bottles of hand sanitizer to the Guam Memorial Hospital. I'm going to bring that up right now. It's on my phone, so that's in WhatsApp. And there right now, I'm showing you guys a picture of GMH, and they were unbelievably appreciative. So 40 bottles of hand sanitizer, and the Guam Football Association, all of their N95 masks, they're helping GMH, because during our commercial break here on Containing COVID, we've been running last night's news story about how the hospitals are actually asking people if they can help. They are in need of PPEs and things like that. So, good on you guys, Guam Football Association, stepping up.
All right. Thank you, Jason Salas here. And Yoli commented, thank you, everyone, for your kind words and condolences. I will share these with my cousin and console her during this heartbreaking time. You may join us for Rosaries nightly on Facebook Live with Glenn Lujan. And then she's got the link. And that's going to be Francis with an I. G. Lujan would be the Facebook that you look at. And, sadly, Bree, talking with Dr. Cabrera, pretty much a done deal that we are going to see more deaths from COVID-19.
Right, and everybody should take this seriously and act as if everybody in front of you, behind you, that it's everywhere.
Right.
So
and let's
heed the advice of staying home.
Bring in one of the voices that's been very consistent from the get-go, Dr. Tom Shea. It's been a few days, Doc. We just kind of wanted to bring you on. Good morning.
Good morning, Chris.
Good morning.
Sorry, I've been busy, so I couldn't take your call sometimes, but you caught me at a good time.
Good. So just real quick, maybe if you want to start last time we spoke, moving forward, your assessment of things since then.
Oh, yeah. It's my wife that called me, and she said that, let's not keep going backwards. Let's not keep saying that I told you so. So I already said I told you so, several weeks ago. So I put that in the past. But what we want to do is moving forward. But to move forward, I think we need to continue to ask for transparency. I think the government, if they want everybody's help, the people of Guam's help, they have to be transparent with the entire population of Guam. So in order to do that, reporting has to be good. Data has to be good. Don't just tell us this and then you're not telling us all of it. Tell us everything you know, okay? It's not the media that's causing the panic. I think we know that this death is occurring. We know that the very first case is a community acquired. It's evidence of community acquired right there and then. We should be locking down, and I think I'm glad that the government extended the lockdown. I don't know if 14 days extension is good enough, but we'll work with it. But, I think the people of Guam know that the virus is here, so I think they know what to do. But we need to keep the message going, and I think KUAM is partnered up with the Medical Association to do some public messages. All the media has, so we'll work with you along with other people. I know Dr. Peter Lombard has been excellent in trying to request for more information.
Right.
Data reporting, because without the accurate data reporting, if they're not sharing it with us doctors, we're not going to know exactly what's going on. So we ask for transparency, not just for the doctors, but for the entire island.
You know, the governor, she does have her physicians advisory group. Are you part of that, or are you guys?
Oh, no. I think I don't think I'll ever get invited back to any kind of advisory group or anything. You know?
Sorry, Doc.
Chris, I could, well, part of it is that I cannot be controlled, and I think that's good and bad. If a government can't control you to go by what they say, of course they're not going to invite you back. It's okay. It's okay. It's okay not to invite me back. I'm perfectly fine with that. But those advisory group people, they still got to be transparent. They have to be transparent, because if they're not, they're going to lose their credibility. And the people of Guam knows. Even the doctors who's on the advisory board, they need to look at themselves in the mirror and be transparent. Ask themselves one question: am I being honest? Are there anything hidden? If they can answer that question and look in the mirror and say yes, then God be with them. But they got to be transparent. Okay.
Doc, what do you make of this way that they've changed their approach to COVID-19 testing? We got the release that now testing is limited to priority groups, which include hospitalized and ER patients with COVID-19 symptoms, people with chronic disease and COVID-19 symptoms, healthcare workers and first responders with COVID-19 symptoms, and older people with COVID-19 symptoms.
Well, I think that's good. I think that's good that they're doing that. I'm not against that, certainly. But I think we still need to conduct more tests. And that's why I'm going to tell you, we're going to try to bring some international kits in. The FDA, the CDC is way behind. Only now they're starting to look at serological tests. If you look at my Facebook post back in January, when they say we don't have testing kits, we don't have testing. Well, I already posted on there, you can test it from blood. And I was right, because international countries are already doing it. It's a rapid test, where you can get a result within 30 minutes, and now it's down to 18 minutes. So that's what they're doing in Japan, Korea, Taiwan, China. So we are procuring those kits in. And, we want to work with the government on this. If we can test 5,000 people, we're going to test 5,000 people. And we'll make sure that those kits are calibrated to make sure they're accurate.
Okay, Doc.
Doc, how much do you think that, and I brought this up with Dr. Cabrera, while we're testing these priority groups, in the meantime, is the disease, is COVID-19 being spread at an alarming rate?
Yes. Yes, and yes, and yes. Because we have evidence of community spread. It's out there. Chris, you're going to assume everybody is positive, everybody's a carrier, okay? When you go outside, distance yourself. This is why we say social distance is very important. And we brought up the fact of Italy, for example. Italy, the Red Cross, the vice president of Red Cross went to Italy yesterday or the other day, and they went there and is evaluating, helping them, saying, hey, why is your death so much higher than China? So they say, you're not properly monitoring your social distance. You're not properly locked down. You don't have a lock. You say lockdown, but it's not a lockdown. Furthermore, at the very end, she almost scolded the Italians to say, you people are not wearing a mask. You people are not wearing a mask. So if you think about it, patients who come into our medical offices, okay, if they say, hey, you have a slight illness or you have cough or any kind of flu-like symptoms, go ahead and put on a mask, because we want you to protect us. We don't want you to spread it. So we put on masks on those people who think they can spread the disease. So if you think about it, if the community is already have evidence of community spread, if you assume that everybody is positive or they're carriers, then they should be donning on a mask when they go out. Now, those people who's locked down in their homes, they don't need to wear a mask in their house. But if you're going to go outside, I think it's okay to wear a mask. Now, if you look at the video, the PSA video that came out of the government of Guam, where Dr. Robinson was involved, he was part of the advisory group. If you listen to his video carefully, he said, go to the supermarket, one person, and wear a mask. So right there and then, Dr. Robinson is already saying, wear a mask when you go out. So if the government of Guam or anybody, or CDC, say you don't need to wear a mask, I think we need to learn from these foreign countries that Japan, very mask-friendly. Taiwan, very mask-friendly. Korea, very mask-friendly. China, Hong Kong. These countries are very mask-friendly, and they're containing their spread. They're containing it. So I think we need to learn from them. I think no longer that we can say wearing a mask doesn't help. I don't think it harms. You just need to make sure that, if it's disposable mask, you got to throw it away. There's no way to really clean it. But the shortage of masks is going to be an issue. But if everybody's on lockdown, and only those people who's going outside maybe donning a mask, that might be a good idea. I'm not saying that I'm right, but I'm saying that this is what the other countries are doing.
Doc, what did you make of Dr. Cabrera's announcement that, given the current spread rate of COVID-19, that our healthcare system could reach a breaking point by the end of this week or next week?
You know, we talked about that last night in our physicians chat. We had about 31 doctors that was logged on to our chat group on the Zoom video, and we were the 7 people. We're talking about an hour, and we kind of wish that he would kind of talk to us. And in fact, we invited him into the video chat. We don't know what the data he is presenting, so we like to bring him in, and I like for him to talk to us about it. I know he's talking to the media and the public, but as a physician advisory group, I like them to be talking to us doctors about it. He had an opportunity to talk to about 30 of us last night. So we invite him to the next chat and present us the data. Tell us about this curve, and tell us about this 33% spread versus 200% spread. Now, I can tell you this, with a population of 160,000, you don't have to be a rocket scientist. With nearly 30 positives compared to Hawaii, yesterday was 48. Today, I think they went up to 50. So 56, I think, today. But Hawaii's population is 1 million people, 1 million with over 1 million plus tourists that's going there. So a population of 1 million people is already at 56, and a population of 160,000, with the density that we have in our villages, we are already at nearly 30. So that'll tell you we are very infectious right now. So we need to make sure that people listen to the governor, stay home, don't come out.
Doc,
come out only for essential items that you need to get, and that's it. And go back home.
I wanted to ask about the home isolation and the 20 that we just found out that there was 20 on home isolation. What are your thoughts on that?
Okay, I think the home isolation aspect of it is okay. Only for sure that home isolation is appropriate for that particular person. If they're sick, they got to be in the hospital. But if they are in home isolation, what I'm talking about is this: they're in a home by themselves, not with a family member. And if they are with a family member, that person who is home isolated, if he is, he needs to be in one room by himself. That's it. You cannot be in a room in a living room with your family members. That's not going to work. So if you turn positive, your other people in the room is going to be positive. And that's happened on Guam, because I got a text from somebody that actually happened. So you got to know that you can spread from person to person. So if you're going to home isolation, you got to do it appropriately and do it the right way.
But do you think people are going to do it the right way if, all they got to worry about is public health calling a couple times?
Well, I think if you love your family and I think if you care, they should. And if you can get the message across, this is what I do. Don't force the people. If you force the people, they're going to go against you, right? So what you need to do is collaborate with them and telling them that, hey, listen, think about your daughter, think about your son, think about your grandma, okay? If you don't want them to get sick, home isolate the proper way. Talk to them and be fully transparent with them. What would happen if we don't? Like, you tell them, you got to do this, you got to do this. They're going to revolt. They're not going to do that. This is just human nature. Right. Same with Gov Guam. If Gov Guam wants us to be a one-team player, you got to be transparent. Come on.
Yeah, I think it's just so confusing and hard for me to understand when, these patients were allowed home isolation on Friday night, and then Saturday night you get Saturday afternoon you get a press release that was only temporary at 9, and then they were going to move to the SNU, and then Monday you find out that there's 20 on home isolation.
It's rapidly evolving.
Yeah,
that's what they're saying.
And then the mayors who were told, according to Robert Hoffman, what he's saying is accurate, that he was told in a group chat over WhatsApp that some of these home isolation patients that don't have, a bathroom in the room, they would be moved to the Pacific Star. So I'm just kind of wondering if you shouldn't have checked that before letting them into home isolation, whether or not their homes were suitable. But
yeah, I think again, if the government couldn't get SNU ready, I think if that was the reason, just be transparent with us.
Right.
the truth will always set you free. That's what I think. And, I didn't make that statement up. Somebody else did.
Yeah, and Dr. Shea, I think at this point, within reason, no one is going to fault the governor. We all know the health, they've been ignoring the hospital, everything it's been decades. So I think you're right, if they come out and they just say, hey, skilled nursing unit, it's a 20-year-old facility. We're not able to get the wings ready to house everyone, so instead we're going to do this. I think that's a lot better than, in this time of crisis, public health emergency. You don't want your government to announce one thing and then do a 180 the next day and then do another 180 the day after that. And
Yes, I agree. And I think that most of our doctors feel that way, that, if they want us doctors together in one team, versus virus, then be transparent with us. Mm-hmm. Don't try to downplay things, or don't try to hide behind a certain curtain and say, okay, this stays in this room, it doesn't go out. Let's not, when we release the room, let's just say this. Those kind of stuff got to be stopped, because when you do that, you split up the group. What you want to do is be honest. If you can be honest with yourself, be honest with the people, I think we will follow. I will follow. But what I can't take is inconsistencies and somebody that's not telling the truth. If we can ensure ourselves that, hey, be totally transparent. For example, I was on the Facebook Live this morning, and I try to do that with my patients every day. And somebody messaged, hey, doc, what about the federal contract and what's going on? Be transparent. And somebody last night, Dr. Akimoto mentioned, there's contracts being sent out. Well, let's be transparent with those contracts. Abigail is trying to get the truth, and they're saying they're not responding to her. KUM, I would encourage you to get transparency from the government. I think that's your job in the media, is to make sure that you seek the truth.
Right. And Doc, so what I'm assuming here is that, they're running everything through the spin cycle. Has that kind of been your experience, that you think that we get information and then they got to kind of write it a certain way so people don't freak out?
It's not. It's too late for that, about freaking out. Let's get over that bridge about freaking out. That's over, okay? What we need to do is try to recover, gain the confidence back of the people, get a confidence back of the doctors. And listen, doctors don't always agree. I can tell you that. There's probably some doctors out there that think Dr. Shea is speaking for himself and not for other people. That's okay. It's okay. I don't mind being overreactive. I'd rather be overreactive than underreactive with situations like this. Even Dr. Cabrera is saying there's going to be death. Well, when you announce that, you don't think people are going to panic? Of course they're going to panic, right? Of course. And we tell people that if we don't work by end of this week, we're going to shut down. Well, people's going to panic with those kind of messages. But I think what we need to do, again, transparency is key. That's going to be the number one thing for this government of Guam. If they want people to follow, they want people to listen, they got to be transparent. And if there are federal contracts out there for federal funding, make it public. Who's getting what's going on, so that everybody can see, so that later on there's no question about improprieties, what's going on. But don't let those contracts, stop this island from moving forward and getting things done. Make it transparent and make it known that, hey, these are contracts going for this hospital. These are contracts going for this clinic, whatever you do. The hotels, what are the hotels getting? Those are federal funding that needs to be accountable. And now is the time for the government to step up and say, this is what we're doing, and this is the accountability we have, and this is what we're allocating to what. That's very important. If they can do that, I think the people of Guam will follow. They will follow because our government is being transparent.
Are you aware of who all is on the physicians advisory group other than Dr. Cabrera, Dr. Cruz, and Dr. Jolene Uggan?
I think so. I think if you look at that PSA video, I think it's on there, and Dr. Michael Robinson, Dr. Jeff Galgo, Dr. Romel Carlos,
Dr. Michael
Dr. Michael is on there. Yeah. So those are all hand-selected people by the governor, or Dr. Mike Cruz. So I think they're good people. I think they're our colleagues. So I will listen to them. But again, they got to be transparent, very transparent. That's going to be the key.
But for now, there's been no communication between the Physicians Advisory Group with the Guam Medical Association.
The only one that's communicated with us is Dr. Hoa, and he tuned in yesterday. So we gave him some criticism about being transparency too. So I think he'll take the message back. But then again, I encourage Dr. Nguyen to be transparent as well himself. So it's very important that, and you got to be very careful. Once the government brings you in, they will try to take control of things. So you got to make sure that you also be transparent. As physicians, we need to do that. We got to be honest with ourselves.
All right. Well, thanks for calling in. I know that we've been messaging each other about partnering with the Guam Medical Association, and so we look forward to hearing from you or someone from the organization on a daily basis to help spread awareness and provide.
I'll try to. You know what I'll try to do is I'll try to get other people to come on the radio with you, and I'll share your number with people who can.
Mm-hmm.
All right.
All right. And I should be expecting more videos today for the PSA campaign.
Hopefully.
Okay.
We're so busy.
Yeah.
Patients in the meantime too.
Right.
Now
right.
I know it's so hard to do those things. God, it's so difficult.
Shoot it horizontally and forward it over.
We're ordinary doctors. We're not professional PSA people.
Right. Okay, Doc, you're pretty handy with social media.
I mean, a lot of the times that when we do the video, it's like one take. That's it. It's like, oh no, what did I say?
Right. Right.
Okay,
Doc.
We'll try to do as fast as we can for you. We'll work with you.
Thank you. Thank you very much.
You're welcome.
Dr. Tom Shea, not changing his tune. A lot of people are changing their tune lately, but they've been saying the same thing from the beginning. We're not prepared. The health system is going to crash. We don't have enough tests. We need to be testing more people. And, that's what he's saying.
Right. And so, like you said, he also wanted to move forward and stop looking back. And he said, all right, I told you so. So that's done. But yeah, like I was saying earlier that, we've been speaking with Dr. Shea about a PSA campaign to help spread awareness and what you should be doing and, washing your hands and things like that. And so we're getting ready to roll that out, I believe, today.
Nice.
Yeah, and every day he's going to try and ensure that we have a physician speaking with us from the Guam Medical Association going forward.
Okay, and for those of you guys just joining us, can we just kind of go over the info that was released last night and some of the details that we got about these patients? Oh yeah,
sure. You have it.
Okay,
so,
sorry.
Okay, so last night we got the latest update from the Joint Information Center at 8:30 p.m. That there were 2 more positive cases for COVID-19. A total of 37 individuals were tested on Monday, and again, out of those 37, 2 tested positive. This brings us to a total of 29 positive cases and 161 cases that tested negative, with 1 death, and that being
Dorian Jesus, which we were able to confirm with the family. So again, our condolences.
There's going to be rosaries on Facebook Live on Glenn Lujan's Facebook page at 8 p.m. The link, you can find it in our comments. Yoli posted it. I did want to provide information because everybody's been asking for some sort of a breakdown, and this was provided last night by the Joint Information Center, and we actually have more details on our social media platforms. But most of Guam COVID-19 known positive cases have epidemiological links to other confirmed cases of the previous 27 confirmed cases, not including confirmed cases from last night, which would bring it to 29. 1, again, as you heard, is deceased. 15 are in stable condition. 11 are in fair condition. 10 are male. 17 are female. 5 are from the north. 12 from central Guam. 4 from the southern part of Guam. 6 still under investigation for place of residence. Now, it's not in this press release, but based on the breakdown that was provided by Public Health Director Linda DeNorsi during the press conference yesterday, 20 of the confirmed cases are locally acquired. Also 20 are in home isolation. Is that right?
Yes, that is right. Yeah, but that's rapidly evolving. Apparently, some people are being moved to Pacific Star. We weren't told about that. We're trying to find out.
And I'm hearing it's quarantine passengers, but then Mayor Hoffman, and I would think that he would be correct, are home isolation patients whose homes aren't suitable for home isolation or equipped.
Right. So trying to do some research. One of the things we were talking about last night was the difference between fair condition, stable condition. So I'm pretty sure it's a simple Google. I'm going to Google that. And, also coming up on the show, Kadu Guam, we're going to have them. They're doing this cool thing where you can donate and get some meals to some people who need it during these to quote the Archbishop, strange times. So we're going to take a break and come back with more of Containing COVID. KUAM News takeover of Guam's favorite I-94. Good morning.
Here's your
on the table and the fork up in the pan, and you better not complain more. You get in trouble with the man. Let the midnight special shine a light on me.
Nothing like a little homegrown in the morning. KUAM News. Joe McCarroll and the gang there, 8:54, Guam's favorite. So did we get that difference between fair and stable, or?
No, I just got this off of Johns Hopkins.
That's a reputable, right? Is it? Would you say John Hopkins is a reputable website? I would say.
Yeah.
Yeah.
I couldn't find stable under fair. It has fair. Vital signs are stable within normal limits. Patient is conscious but may be uncomfortable. Indicators are favorable. That's fair. There's nothing here that says stable, so
Okay.
let me keep looking.
Okay. In the meantime, let's touch base with former Governor Eddie Calvo last night to kind of maybe fold him into the conversation for some perspective. Good morning, Gov.
Good morning, Chris. How are you doing there?
We're doing pretty good. Just washed our hands. Gov, are you there?
Oh, I'm sorry. Yeah. Continue. I'm sorry, I missed that.
I said we'd both just washed our hands, so you're clear.
Some sanitizer on.
I've got hand sanitizers. We've got detergents. My wife and I have, of course, we're empty nesters, so we're ensuring that at least in the areas within the home that we keep everything clean and sanitized. And of course, we're also praying for all the people in Guam and the nation and the world that we can get through all this.
I wanted to ask you, Gov, we're waiting for the announcement from the governor on the declaration of a major disaster. And so I wanted to get from your perspective, when that is declared, what actually happens?
Well, with a declaration of a major disaster, similar to what we've had in the past with and Guam has experience with typhoons, with our earthquake. That entails certain, and of course laws have changed, but there's certain authorities that a governor has in an emergency, and then of course with the calling of a disaster and this communication being made to the federal government, it allows us for certain programs. Now that was in the past. Things have changed. There have been initiatives made through executive order by the President of the United States. I know the Congress had passed some legislation. They're now in an impasse on a third bill that would again deal with both the health and economic issues of the nation. So things have changed since I've been governor, but obviously with the calling of a disaster, it opens up also programs with the federal government. The issue is now for us in the past, for me, when we've had situations in Guam, it was a disaster in Guam. And, FEMA was again, participated to a great extent. This is interesting now, and the uniqueness of all, it is a disaster not only in Guam, but concurrently with the rest of the nation.
And the world.
Right.
And the world.
Wow, that wasn't very comforting, Gov.
Perspective here.
Right.
This is a unique situation, and I pray for the governor. I pray for all our elected leaders. The times that I had as 8 years as governor, there were certain events, whether it was the tsunami that hit Japan, where we had to move quickly. We knew that it would take 3 hours for a potential tsunami to hit the shores of Guam. We had the financial disaster of our island government when we came in, but that was something where it was strictly economic and financial in nature for the government. And then we had the North Korean crisis, which we could see the enemy. We knew where the missiles would come from, and working with the federal government and the Department of Defense, it was for us in Guam preparatory in terms of sheltering in place and perfecting that, and ensuring that information was made quickly to the public. And at the same time, it was for the Defense Department to put several layers of shields between the potential enemy, which was North Korea, and Guam. But this is something different. It's insidious. My concern is, we've had 20 out of 29 of the positives that have no travel history, which means the contagion is occurring from within. And so for Guam, the crisis is twofold. It's a health crisis, and there's an economic crisis that is also occurring, and we've got to deal with it concurrently.
I kind of feel like we can't really deal with the economic aspect of it until we deal with the public health
aspect.
Well,
front.
Two things. Well, what's going to happen? They happen concurrently because, on one hand, we have to, contain the spread of this virus within our community, and with that, we've got to make sure that those that are afflicted, that the facilities in terms of health care are up to standard and up to the task. On the other end, as this moves along, and when I talk about economics, I'm talking about, let's go down to the individual and the families. People are losing jobs at a rapid pace. They're losing the ability to purchase foods and medicines. So there is, you can't say one or the other. It's both. So if people are losing jobs and having the inability to provide for themselves and their families, that is a crisis as well. So this is why, our policymakers, our leadership, both in elected as well as in leadership throughout the island, have got to work concurrently and collaboratively on dealing with these issues. And again, it's a crisis. This is something that is unique. It is happening in Guam as same as in every other community in the United States and in the world.
Governor Calvo, as a former governor of Guam, and who has dealt with disasters and crisis situations, not necessarily of this magnitude. What do you think Governor Lulian Guerrero's days are like?
Oh, let me tell you, I pray for her, and I think what's happening is this. When a crisis hits, and let's say, I'll give you an example, the North Korean incident. You bring together your emergency action team, and of course at that time it was Homeland Security. We sat down with the Defense Department, direct communications with the White House in the potential impending threat. The same time there was the unfolding crisis, and it wasn't a health crisis, but it was of the economy, the drastic reduction in tourist number over a very rapid, in a very quick manner. So you bring people together, you share information, the decision makers make decisions, and there's transparency. You get this information out to the people. But as you try to deal with the crisis, folks, we're not only physical beings, we're spiritual beings. For the governor, and I mean it, you can get all the advice, and you make the best decisions that you feel are in the best interest of the people. But there are times when you in your free time, you get on your knees, and for those that have faith, and you pray for divine guidance. And whether you're a Christian or whatever other religion, and you're hopeful that the Holy Spirit can come into you and come into those around you, that when decisions are made, there is divine guidance in those decision-making process. And I must tell you, in some of the crises that have occurred when I was governor, you have people around you, and you take it all in. But then you look up to your maker, and you ask for that help, and prayers and meditation can do that as well. And I'm praying for her.
Gov, so at the kind of the outset of all of this COVID-19, the governor and her fiscal strike, what is it? Fiscal team came out with this team. It's a team economic relief. I forget what the TEAM stands for. But basically they were saying we're going to defer 40% of BPT payments for 90 days. So it was kind of confusing, honestly. There was a lot of deferring, and then there was something about we're going to waive your credit card fees if you're paying your bills online. And then the governor's fiscal had also said that, hey, Waterworks, Power Authority, they're going to do like a payment plan. Do you think that, obviously, this is kind of a dumb question, but do we need to go back and maybe revisit that economic plan, or do you think the governor's maybe going to hold out for something federal, some of that federal money?
I think this is no time to hold back on anything. This is time for all the leadership. This is a fluid situation. Mm-hmm. And decisions that were made yesterday, there has to be a reassessment, evaluation, looking at the situation as it unfolds today, looking at all and looking and talking to the experts, both medical, both economic in terms of the private sector, and your agency heads and your federal partners, and then make new decisions based on where we're at now. This is not a time for the status quo. This is a time for assessment, a reevaluation, creation of policy and initiatives, and then moving on them. There will be a time to evaluate things and how we've moved forward, but this is not the time. The train has left the station. Again, when you get 20 out of 29 positive that have no travel history, the train has left that station. And what we want to do now is not to critique each other in terms of how this should have been, when it should have been done. It's about now making sure that when that train is going, and there may be a gully or a valley that this train is headed, that we do everything we can to stop this train from going in that direction. And that means all hands on deck, and that means the collective forces that what we have here in this island, together with our federal partners and of course, with our leaders in Washington, D.C., both the president and Congress. But it's an evolving situation.
Rapidly.
I think it's important, and I think it's important for, again, the communications lines to be clear between leadership and then also those lines of information also in terms of transparency to the general public. And that's why, what you have right now with social media, with the communications that occur not only through broadcast but through the internet, we have the technological means of sharing information quickly, and it's important. We do get this information quickly to the people.
Well, that's what we're trying to do.
Yeah. Gov, thank you so much for your time. I know you got important things to do, like, spend quality time with the wife.
And again, my wife and I the good Lord has blessed me with a beautiful wife. Right now, I'm missing my children and grandchildren. Everyone's practicing social distancing, and my wife and I were commenting, boy, we miss our grandkids running around the house. Mm-hmm. But we are in a state of siege. But Chris and Sabrina, thank you for this opportunity for me to speak. But I think it's an opportunity now for all of us really to put both introspective, looking at it's important in our lives, with our families, with those we love, and then at the same time, all of us contributing in one way or another towards getting around through this crisis and coming out again back to some sense of normalcy. And hopefully it will happen in the near future.
All right. Thank you.
Thank you very much, Governor.
Be safe.
All right. God bless you all. Take
you
care.
too. Thank you.
All right. 908.
That's former Governor Eddie Bazacalvo.
Yeah, and just
giving us his perspective on what Governor Lulian Guerrero must be going through right now, and from one governor to another governor, he's praying for you.
Yeah, and he suggests that Governor Lou also do some praying.
She probably is.
Yeah, I'm pretty sure she is.
We all are.
Yeah. One of the things I thought was interesting, what the governor said about lines of communication being open with all, leaders, elected and otherwise. We're going to bring on one of our elected leaders, Senator Jim Moylan. We can take a break, Bree, and we're going to bring him on. And he wrote some letters. I'm pretty sure he's got his own style of perspective to share with us. So that's going to be good. Hey, Facebook comments. Thank you guys so much for those. You keep them coming here. Again, containing COVID, it's the KUAM News takeover of Guam's favorite, I-94. Good morning.
Make sure...
Half a day, it's day 5 of quarantine. Just trying to soak up some of this late day sun, get some vitamin D. It's good for you, so is vitamin C. According to all the research I've done, if you can get some, get some. We're here in quarantine. Not much has changed. I want to thank everyone who's called and reached out and texted to check up on us here in quarantine. It's going. They feed us 3 meals a day. The food truck Guam and their crew has been very good about keeping us nourished and meeting people's dietary needs. At least in my case, I encourage anyone who has any dietary needs to reach out to them. Other than that, not much going on. We still get temperature checks, but now it's once a day. If you continue to answer no to the questionnaire, they will just come in the mornings and give you a temperature check. I've been consistently reading about 96.5 temperature, so I feel good. Can't wait to go home, but still, this thing doesn't show itself right away, so symptoms can come up later. Pray to God it doesn't show up for anyone here in quarantine or anyone else on the island. Messages still stay home. We had a spike of 15 people just yesterday, and that's expected to rise. If you have been following the trend, what's been happening around the world, I have been following what's been happening in Manila and other countries where I was staying. That's just the beginning. If those 15 people went out and were socializing and not being safe, then they probably infected people. Remember, it's asymptomatic. They're not going to show any signs of this virus. So please stay home. For the love of your family, stay home. That's all you got to do, and so we can figure this out. If we overwhelm the healthcare system, then God help us. That's all you can do is stay home. That's all we were asked to do is stay home. Stop fighting the system. Stop talking about martial law. It's not. It's just for the good of our island and our people. Stay home. We're here another 9 days. You guys can do it. I'm doing it here with everyone else in quarantine.
Jack Larimer. I just wanted to play this so you guys can, take yourself to brunch on the inside.
On the inside.
Because he's always playing at brunch. Wow, brunch seems like another lifetime ago.
Yeah.
Right? I mean, it seems like the other day we were at that Filipino
what life
thing.
was like 2 weeks ago.
I know, crazy. 9/12.
I can't even remember.
Former Governor Eddie Calvo on the line, and he talked about all hands on deck, Sabrina.
Right. Everybody should be working on this crisis because we're dealing with two, the health crisis and the economic crisis simultaneously.
And, I really appreciate the way the Gov kind of set me straight because I whenever I hear economic, I just think, businesses. And that's why I said, I think we need to work through this public health thing before we get to that. And he said, no, I'm talking about like people. I mean, people they're running out of money to buy food. They're running out of money to buy supplies. We just got told that hunker down for another 14 days. And this is it's a very real reality.
And when I was outside earlier, I still kept seeing a lot of cars just driving by. There's another one.
Right.
And so...
Yeah, and I agree with Dr. Shea, a little wishy-washy to say we're closing the beaches and the parks, but if you're going to go walk into the beaches and the parks, then you can go walk. I just think we just got to be firm.
Yeah.
Just be straight up with the people. If you don't want anyone to leave, then tell them that, 9:13. And so we talk about all hands on deck. Wanted to bring Minority Senator Jim Moylan up on the show. Good morning, Senator.
Hi, good morning, Chris. Good morning, Sabina.
Good morning.
So I guess just right off the bat, to kind of unpack what former Governor Cabo was talking about was all hands on deck. Yet we get the announcement that session has been postponed until further notice. Let's just start there, Senator. What are your thoughts on that?
There was an attempt to have a special session Monday, and the call went out to the senators on our chat group, and the response by the majority was self-quarantine at home, to follow suit by the governor, not knowing if any of us are carrying any are positive, since I'm not sure if any of the senators have been tested, but as I understand, we probably won't unless you show signs that you need to be tested, since the kits are limited at this point.
Right, and then now they came out with new information that they've kind of reinvented who they're going to test. Maybe that's not the right word, but they're basically testing limited priority groups. And so they're not really accepting tests from, they are, but those are being backlogged, we're being told. So,
correct.
Yeah.
So since that is the situation, the Speaker decided not to have a special session at this time until further notice, but the Speaker did write to the committee chair on rules to look into and see how we can start doing things online, like mostly everybody else is doing as well.
Has been doing, Senator.
Through Zoom.
Right. Yeah.
Right, which is a great idea, so that we can continue business, right, and move forward. But there's some rules that we must have in place, and how do we ensure that each one of the 15 are recognized, and who gets the first say, and when do we vote, and so nothing is cut off, and so hopefully we can get to that point quicker, which was something that I'm happy the governor did the other day, yesterday around 4 p.m. We had a conference call. The senators had a conference call with the governor, and it was the governor in her large conference room with the lieutenant governor, president.
So you saw the lieutenant governor?
Yes, he was in the conference room and was communicating with us, the senators, as well as the chief of staff was in the room too.
I just want to say we have a Josh Tenorio sighting, everybody, in case you're wondering.
Yeah. And he was very active, sounding really strong. So yes, I'm glad he was present there as well.
Good.
And basically, the governor gave us the information she has recently provided to the public. And this is all really helpful. And as we're going through this, what a learning experience, right? I think we have improved on the transparency. And more questions come up, but the governor has stated that her attempt will be I think now it's 1 o'clock daily. She'll be able to have these press releases, and that would help us answer, because a lot of the questions, because daily we also have questions. So by the governor's, with the governor's cabinet, hopefully we'll get that answered, and we'll be able to give more ease to our community. And that's what we're looking for.
Right.
We know we don't have all the solutions, but as long as those questions are asked and responded to, then it helps us feel like, okay, we have it under control. And it's not an easy thing to do. I completely understand that. But I know as an island, I think we're really improving on that. And we should be able to get over this. Once we get the height on this bell here, then once we plateau, then we should be coming down and we can move on, and things will get back to normal eventually.
Man, it's very entertaining watching the governor's office try to figure out the Zoom app. I can only imagine you senators trying to figure it out. I want to watch that one.
Yeah.
I don't even care if it's a boring session. I just want to watch you guys cutting each other off.
Who's
muting who?
Yeah, it is interesting, and you have the option to show your face or not. Did you shave today, or
right?
Did you brush your hair or not? So, but it went well, and I'm glad that we were able to do that, and I'm sure we'll be having more opportunities. But in the meantime, yes, the legislature is not in session until further notice, and maybe by then we can have something communicate online like you folks are doing, and like all the other news reporters are doing.
Should more have been done, though, Senator? I feel like, no knock on the speaker. We asked her to call and, talk about this, but should more have been done to kind of maybe show the people? Because what are you guys even doing? I tried calling a senator's office yesterday at 3:30. I got no answer. I know we're shut with the government shut down, but are there things that you guys can be doing, and should the concessions have been made earlier on to kind of look at like, hey, how can we meet in case, we talked to a couple of your colleagues, namely Senator Teletaidegui, Senator Theresa Lahi, and they both feel that, this is the time when you guys need to be having session. This is when you are needed by the people who elected you in office.
Definitely, and in hindsight, yes, we should have had that already prepared for emergency situations just like this. And I think that helps this body, the 35th, reprioritize what we should be really focusing on during sessions, right? It's going to move, not that other things are not important, but there's things that should be category A, B, and C, and for the good of all. And one will be that situation, of course.
We're going to go into Zoom mode in the event there's a pandemic or something, right? Senator, so how are you guys going to handle this veto? The governor just vetoed Bill 308, and so is that just going to fly now that session has been postponed till TFN, till further notice?
Right. I don't see if we can come to online ability to create a vote to override that. So at this point, I would say that's where it's at. It's vetoed, but hopefully on at least my side, I'm working in support of HR 6321, which is the comprehensive stimulus package from, of course, the federal government, and we're raising our voices to ensure that the territories right now they're included, but you never know, right? It could be a bargaining, and it may drop off because somebody doesn't know about Guam again, right? So. We sent our letters. We're in communications with Department of Interior, Doug Dominich, and of course we're communicating with our Congressman Mike and the GOP, Juan Carlos Benito and Tony Ada in Guam Chamber. And so it's a collective effort that what I'm trying to do is continue that conversation with them to remind them, don't let the territories drop from HR 6321, because that's a collective effort. It's a financial relief that they're looking at for the families, mortgage relief, even if you got a rental relief, and then of course the pandemic unemployment assistance to ensure that the people of Guam are included and not dropped. We're a little bit late to go into session now, and it's probably going to be difficult. But in the meantime, at least your senators can still reach out to the federal side and say, hey, don't forget us. We're over here. We're the tip the tip. We understand
Just the tip,
the
right.
East Coast is East Coast and West Coast, but we're the furthest west, man. So, and we had the military base here, and there's still the threat is still out there. Of course, we had to protect our military folks here in defense of.
I thought they had to protect us, Senator.
Well, that as well. Yes, that's for sure.
I'm not sure if you guys covered this because I was looking for information for Chris, but
Thanks for that, Bree.
Yeah, I'm pulling it on my computer for you, so
Okay.
okay. But yeah, I wanted to ask, did you ever receive a response to your letter?
Can you just run back what was the letter? 'Cause that was what was your letter about, Senator?
Yeah, because I'm
just reinforcing HR 6321, pointing out our situation being, it's of course we have some similarities to the U.S., but really with our island size and our reliance on the tourism and 40,000 employees that somehow their lives and businesses are affected through tourism because everything trickles down. Our economic disaster would be tremendous. And so we really highlighted on that. We did get one response from Department of Interior, Doug Dominich, and he appreciated that we did write and explained our situation even harder, and we're hoping that he can share that letter to get it circulating. So just in case somebody else has some questions, but just circulate that amongst everyone there. Likewise, Congressman Mike St. Nicholas. These kind of letters of support coming from your senators on Guam would emphasize the importance that Guam is really important right now, and especially needing the financial assistance because what else do we got? I'm sure we'll come together. But the economic impact will be so tremendous. Like, just as an example, last night I took some pictures. I can see the hotels from my little balcony here.
Yeah.
And Holiday Resort, not a light on in any of the rooms. I looked to my right. What is that? Outrigger. It was just blackened out.
Did you see any lights at Pacific
both
Star? We're hearing there might have been some activity at Pacific Star.
Yeah, because that's one of the shelters, right? For those the waiting period.
So we need you to be our man in Tumon, Senator.
Sure.
We're not going out in the field, so keep an eye out. Yeah,
I'll be happy to.
Okay.
Yeah, and
Man on the go.
I did take my walk this morning, but of course we take our social distance, and you wave to people across the street, and but there are people out there just taking their walks, but it's not in large groups because it's important that we also get our exercise, especially those that are required to do it. More importantly, and get the sunlight, but don't hang out with a bunch of friends and start the barbecue and pop up the tent and get your cooler out and have a 12-pack.
Right, definitely not.
Yeah.
Senator, so we're talking about this, Bree found it.
The transparency.
Transparency during this pandemic emergency. One of the plethora, the veritable cornucopia of letters you've sent to the governor. Did you get a response to this one?
The response I saw was on the media.
Okay.
And questions were answered on the media. And we kind of echoed what the doctors were requesting as well.
Right.
More detailed information was provided. Not to say that the administration wasn't doing it correctly, but what we really need is more details without releasing the personal information.
Right.
Yeah.
And, Senator, what we saw last week, it kind of started with the media. By Tuesday, Wednesday, residents were like, we need more transparency. And then we had the mayors, the doctors, and the senators all kind of chime in. And, for what it's worth, we did get more transparency. Is it at a level that we're comfortable with? Could there be more? Always, of course.
Sure. Yes. And I think that's forthcoming now. And that should be a regular cycle. And especially the regular briefings, is the administration is able to do that 1 o'clock every day. That's great. And then that it helps us with our confidence level and as we move forward.
Right.
And then the sense of urgency is there, and so as long as we hear it, then I think that's better off. And when these questions are asked, then I would feel that will be helpful because, gee, I didn't think about that, or hey, that's a great idea to help improve it. So.
Well, there you go. Hey, thanks for chiming in, Senator Moylan, and you be sure to call anytime you got any new developments, anything going on your end.
Let us know if there's any movement at the Pacific Star.
Right.
I shall. Sure.
Okay.
I shall.
Okay.
All right. Oh, by
Thank
the
you.
way,
Yeah.
speaking of that, the Pacific Star, they do have their guards out, just like every other place that is using as a holding place at the moment. So the guards are there checking before they come in.
Okay.
Okay.
All right.
All righty.
Okay.
Have a great day.
Thank you.
You're welcome.
too.
There you go,
Wash your
Senator.
hands. Be safe.
Yeah, Senator Jim
Took your
Moylan.
line.
Yeah. So maybe we'll get more info about this Pacific Star movement
At 1 o'clock.
at 1
hopefully.
o'clock. Yeah. So there's a press conference at 1 o'clock. Zoom. We're going to be doing that live on our Facebook, right?
Yes, live like we did yesterday. I mean, there were some issues at the beginning because of the microphones that were being on with the reporters, but hopefully those kinks will be worked out today.
Right. We had a comment here. First sighting of the lieutenant governor. And that's, you know, I was kidding. We're just talking over the last couple of days. Like, has anyone seen Lieutenant Governor Josh Tenorio since that first press conference? And we're like, no, we haven't seen him. So, you know, we made the same call about the gov, and then she started coming out doing press conferences. So, you know, maybe say throw Josh a press briefing here or there, just you know, get him out there in front of the people. Because people wonder, you know, like, oh my God, people are talking. 9:27. Let's take a break, Bree. As containing COVID, the KUAM News takeover of Guam's favorite I-94. Good morning.
Banners.
Like many in her field, University of Guam Dean of Nursing Margaret Hattori Uchima is concerned about just how stretched thin Guam's healthcare professionals are. Uchima says these critical shortages existed long before COVID-19 started making headlines nationally and locally.
We've been crying for help for GMH for years. This is not anything new.
Yeah.
And so we haven't bolstered that system. We've always had a nursing shortage. We have a physician shortage.
Uchima says the Guam Board of Nurse Examiners, through the governor's public health emergency declaration, has been able to do more to help recruit crucial positions. She adds that nurses from around the island, including school nurses, have been activated as well. So if you think you can help, if you have any sort of medical background, you are needed.
We have had nurses that have a Philippine license that didn't get a U.S. one yet. And they can get a temporary Guam license if they meet certain criteria.
She also said retired nurses have reached out to help, and Uchima saying at this point any and all volunteers are needed, even for something as simple as answering phone calls. And while nurses, doctors, and medical staff are on the front lines of the COVID-19 battle, Uchima said it's good to know they aren't alone in that fight.
I have people texting me day and night saying, what can I do to help? I have people right now getting food for nurses. All weekend we've been trying to make sure that the people on the front have the supplies and the food. So, it's early in the game, Chris.
Uchima said she has been touched so deeply by Guam's generous nature, and it couldn't come at a better time.
I'm not one to ask for help, but, the last week, I don't care. I'm calling anybody I know saying, hey, can you donate water?
Right.
And people are pulling through. It's amazing.
If you want to help, reach out to the Guam Board of Nurse Examiners at 735-7408 or 7409. For Guam's News Network, Chris Barnett reports. Daryl Garcia. Thank you to our Facebook Live listeners. Our buddy Glenn. We are going through this together to protect our people's lives and our economy. It's normal to be fearful. Praying to all the great minds out there working on this. It's not easy. Let's continue to work together. Love and prayers for all of us. He goes on to say, a good tip. Washing fruits and vegetables with warm water to sanitize before consuming.
And Glenn is actually related to Yoli.
Right.
So you can go to his Facebook page and watch the rosaries at 8 p.m.
And the link is like way further back, maybe left. You can find the link that Yoli actually shared to where they're going to have those Facebook Lives.
Yeah, Glenn's Facebook page.
Right. So, Glenn, if you could maybe just leave a comment in there and people can go back and check that. If you're just joining the program, we're able to talk to a niece of Doreen Jesus. Now, sadly, Doreen Jesus passed away from complications related to COVID-19. I believe she stayed in Chalampago across the church is what we're told. She was very, very faithful, a big part of,
to sing.
She loved to sing. Her family, you see on Facebook, they talk about her voice. There was something that Yoli had said that even when she was getting mad at you, it sounded good.
And she played the organ. She was very close with
Father Eric.
Yeah.
Right. So there you go. And really just wanted to give you not just a name to attach to that or a face, but a life, that was someone's life. And as we heard from Yoli, the family is struggling to deal with this.
Yeah, they didn't get a chance to say goodbye or see her because of the situation, and
right.
They cremated her, and there's no telling exactly when they'll have a memorial service because of what's going on.
Right, and so I guess the protocols from what Yoli was able to share with us is within 24 hours of somebody passing from COVID-19, they have to be either cremated or buried.
Right.
And so that's one of these, behind the scenes things you might not even think about, but it's something I think that we all need to mentally prepare for, as the governor's representative from the Physicians Advisory Group has basically come out and said that we're not flattening the curve, and that our health care system could reach a breaking point as soon as this week or next week.
Right. And when you hear the latest results from last night, that there were only 2 confirmed cases out of, I think, the 37 that were tested on Monday. Don't think that we're in the clear, everything's looking good. Don't have that false sense of security. And
that's one of the things that Dr. Cabrera said is, the results that we got last night are a result of the way they're conducting the testing now. There has been a change in how they're conducting the testing. And Bree, you want to just read that off here?
Oh, okay. They're now testing 4 specific groups that will be prioritized for testing. If you missed this earlier when we read it off, that hospitalized and emergency room patients with COVID-19 symptoms. These patients are already sick, and our health providers must be protected, early identification of a COVID-19 infection will keep our hospitals safe. The other category is people with chronic diseases and COVID-19 symptoms. This includes diabetes, cancer, advanced kidney disease, and others. These members of our community have an increased risk of becoming severely ill or even dying from a COVID-19 infection. They need to be diagnosed as early as possible. And again, I am reading the 4 specific groups that will be prioritized for testing for COVID-19. The third category, healthcare workers and first responders with COVID-19 symptoms. And 4, older people with symptoms of COVID-19. It is very clear that older people infected with COVID-19 get sicker faster and die at a much higher rate compared to younger people. And again, those are the new COVID-19 testing limited to priority groups, and those were the 4 groups.
Right. One of the comments that we're getting off of WhatsApp is, can we ask the governor about any type of rent relief? Have we heard? I heard they were working on that nationally on the congressional side. I don't know, maybe Nestor has something on that, but locally we haven't heard anything.
No, I don't think I heard anything. I'm not sure if there was something from.
I don't even know if she has the authority to do that.
Yeah.
But I did get a notice from my landlord, the company that represents her, and they basically said if you have any issues paying your rent because of COVID-19, then you better get your documents in order. All right, so there you go. And these are, it's one thing dealing with the public health emergency declaration, which again has been extended another 14 days. In case you didn't know, I don't know what you were doing, but you should know that we're going all the way to April 13th. But when talking to Dr. Cabrera, he's expecting this. He said it could stretch months.
Right. Well,
months.
What did President Trump say during his special address last week, I think,
right,
when we first went on the air? And that was one of the questions. How long do you think this is going to last? And I believe he said August.
Yeah, let's get Sean Gumatato on here. Always great to have your perspective. Good morning, Sean.
Hey, good morning. Good morning, Sabrina.
Hi, Sean.
I tell you, I'm walking down Tumon right now, and it's another beautiful day in paradise, but pretty empty in our tourist district today. And that's an understatement.
And it should be, right? Yeah. So we've now got an extension of the order. Sean, let me ask you this, just first question. What can the government do to kind of reassure people and help them process that, we're going to be essentially locked down for another 2 weeks? Well, 3, considering we still got to get through this week.
That's a great question. There's the toughest part for this whole thing, and I've been kind of pondering on it for the last couple of days. It's really going to be very difficult. Obviously, from the messaging that started last week to today, obviously it's gotten better, right? But the general public continues to struggle with believing, or at least the credibility of the administration today on the response. I'm staring right now at the Pacific Star Hotel. There is a lot of there's police, or I guess you call them medical folks, stopping the traffic coming in. But everyone that's driving by is pretty oblivious. They're just doing their thing, trying to get to work, or in some cases, they're just trying to maybe just move in and around Tumon. But it's going to be credibility, and I think people need to see the result of the closures and all this shelter in place. If it works, then we want to see it, and we want to make sure that the community is safe. And I think that's the reassurance moving forward we're all going to be kind of saddled with over the next week, actually the next 2.5 weeks.
Right. Sean, how important is it for the governor's COVID-19 response team to be proactive in coming out with information versus what we have now, which is pretty much reactive?
I would say, Chris, that I was fairly pleased with their response yesterday, but that was needed a week ago. And so then there's that tempo that, from an operational point of view, that the administration is doing everything that they can to kind of get to the ground on what's going on with this whole pandemic issue. If they did that early on. Okay, now let's go ahead and erase that for a second. But yesterday, what they need to tell us a little bit more is, and I think, Sabrina and I were kind of WhatsApping back and forth, but we definitely got to know with each press release how many people have been quarantined on these flights. If right now, my understanding is as high as 400 people that are currently quarantined, and they moved those folks from one location to another, which I think was a big logistical feat in itself. And they should be given some kudos. But again, from a planning point of view, they should have let us know a little bit early. And I think don't expect that the Pacific Star would be the only place that would be used over the course of the next couple of weeks, especially if it increases. But we're hoping that it'll calm down, and then there's an ability for kind of some level of normalcy. But with the Pacific Star being used, that's almost like a symbol to our community that, hey, this issue is a little bit greater than we could have ever expected.
Right. We moved to a big hotel, in other words.
Exactly. I mean, I think people were a little taken aback by the Santa Fe or the Wyndham Hotel. But as soon as you go into the middle of the tourist district, it has a much different type of message. And is it, hopefully people are behaving themselves. I see people out on the terraces now enjoying the sun. I guess you mentioned earlier the best thing you can do is get some vitamin D, and I guess they're getting some of that now. But, this whole now is a little bit different symbol of our response to COVID-19.
Sean, this kind of seems like something that, maybe we could have planned ahead. I mean, you look at how many flights we got coming in, how many passengers are going to be on those flights, how many rooms we're going to need. I don't know.
Right.
Is that a crazy assessment?
No, it is. And I think that, when we think about our current tourism numbers, when they're averaging, I think the number roughly is 10,000 tourists a day are on Guam at any given time during the day. So, you plan accordingly. But when you remember this thing started to happen, we started seeing people leave. Fairly few were coming. So, I've heard some estimates as low as 40%. Remember, they're still coming in. There's no question that tourists are still coming through the gates. They're quarantined and they don't seem to be averse to it. But you're looking maybe 5,000 as a rough estimate. But just think about that for a second, Chris and Sabrina. That if that many people are still coming in, Pacific Star I don't think is going to be able to accommodate folks moving forward. Especially if they leave, hopefully they're not being replaced behind them with such restrictive quarantine efforts.
All right.
Okay, Sean.
Well, thanks a lot, Sean.
Hey, can you take some pics for us? I don't know if Bree wants.
Yeah.
We got you and Senator Moylan down there. You're our men in Tumon.
Yeah, no, I'd be happy to. I think that the biggest thing is, as people are out and about, you can sense on the beach, especially a lot of social distancing. But there's normally a lot of people out there, but there isn't a lot today.
Right.
Very few, and then on the run, very few are even running. I think I might have walked or at least came into contact with at least 12 people the entire last hour or so. So it's a little light down here.
Well, thanks, Sean, for your perspective, and we look forward to talking to you always.
Yeah, no, listen, and I would encourage all of the listeners today on both KUAM Radio and on the Facebook Live to continue to keep monitoring KUAM's, all of the KUAM family, and throughout the day for updates. And again, it's better to be informed than not to be. And again, stay at home if you can. There's guys like myself and you guys that are having to work today. Obviously, we got to do what we have to do. But in terms of taking care of things, just be safe out there.
Thanks, Sean.
Thanks, Sean. Again, that was Sean Gumatauto. He's actually a former anchor. Me and him, we
got a comment here. Where is it? From Liz, Sean and Sabrina, OG KUAM reunion. I used to watch these two on the news when I was a kid. Well, there you go. Showing your age there.
Yeah, but he also was a lead PIO of the government of Guam from 2003 to 2011. He was the communications director for former Governor Felix Camacho and Lieutenant Governor Kaleo Moylan, and then again for Camacho and for former Lieutenant Governor Mike Cruz, who is now the state, I guess, medical surgeon general for Guam after being appointed by Governor Lulian Guerrero. And he, for the most part, is a head of the governor's physician advisory group with other doctors.
All right, so let's go to our man in quarantine, Dave Sablan. Of course, a lot of people have been following his...
chronicling COVID quarantine.
Right, so... Dave, where are you at this morning? We know you had been at the Wyndham. Are they moving you?
No, I think it was at Days Inn.
Days Inn?
Yeah,
Okay.
Days Inn. Did you get moved?
Yes, we did.
You did?
Good
Okay.
morning.
So you're now where?
We're presently at Pacific Star.
When did you move?
They informed us that we would start vacating our last hotel at 8 p.m. last night, shortly after dinner. So they started moving us in groups, small groups. But this is like a bad sci-fi flick.
Just keeps getting worse.
Putting us in the cover of darkness, and and we were just getting settled in. I was really comfortable there, and trying to move us to another place, and I was very apprehensive about moving to begin with, because then we were going to commingle us again with each other.
Right, Dave.
Do you know who?
I'm sorry?
Dave, so I know you're not a doctor, but the way they're moving you, are you concerned at all that there may have been exposure from people who haven't been tested? I mean, you guys are kind of flying blind. Are you getting tested, first of all?
No one's been tested that I know of. They're just doing temperature checks.
Mm-hmm.
So I've been very concerned from the start, from the way they've bunched us together. They've tried to mitigate that with smaller groups, the movement and practicing social distance better, as we go through the process. One of the concerns I had here that was brought up at our old hotel by someone who's, I guess, a health professional is the aircon ventilation system. I was just looking at this thing last night, and I think if all these rooms are hooked up in this ventilation system, there might be chances of maybe people getting contaminated through the aircon vent. I mean, at the other hotel, I was satisfied because each room had a freestanding aircon inside, so chances of that was 0. But I'm not sure about this hotel. They don't have freestanding aircons in each room.
How many? Was it just quarantine passengers from Days Inn that were moved, or are you aware if all the other approved quarantine sites were moved there too?
It was us and Wyndham, because I believe the two hotels there were taken up by one flight, so they wanted to consolidate the one flight here.
So you're not aware if the quarantine passengers that are being quarantined at Santa Fe were being moved to?
No, I'm not aware of that being moved here.
So were all of you guys moved to Pacific Star? Is there anyone left at the Days Inn?
To my knowledge, I'm not sure about that. I believe we all left. That everyone that was quarantined there from the flight left, were removed.
Did they tell you why? I'm sorry, did I miss that? Did they tell you why we need to move you to another hotel?
They wanted to consolidate everyone from one flight here. It'd be easier for them to control and for security purposes.
Okay, for security purposes.
Right.
Because the mentality. It's really scary to think. I was in the elevator, down by the elevator, waiting last night to go downstairs to get my suitcase, and they wanted to come down single file or one at a time. And there's an individual out there who was apparently talking to his girlfriend on the phone or whoever it was, but talking about trying to sneak her into the hotel from the basement. I mean, with that kind of mentality, dude, you're an idiot. What are you trying to do? Really, what are you trying to do? If anyone was infected and she was here and then she snuck back home and then she got it and spread it, come on, guy. Wake that up, man. This is serious.
Yeah.
This thing is like, again, it's in its infancy stages, and I pray to God that the numbers don't jump too drastically. But you don't see that jump right now because there's not a lot of testing going on. The more more testing they do, the more positive they're going to find.
Dave, how many are you able to tell us? How many total? Any ballpark, any guesstimate of how many? Are we talking a couple hundred? We're just hearing different numbers.
At the most, I'm not sure. I mean, you figure there's three floors at the hotel I was at, and maybe 20 rooms per floor. That's just one hotel. So 20 times 3, that's 60 just at our hotel.
Right.
What's the sentiment of people that you were able to talk to there? How are they feeling about the process and thus far, and how you guys have been treated?
Well, concerned with the people I've been in contact with is prior to us being moved, they sent us a document for us to sign that was a voluntary quarantine, but none of us were voluntary.
So did you guys sign that form, Dave, or what?
I didn't sign any form.
Say again?
I didn't sign any form. I still have the original document that was a involuntary quarantine, and that's still the case with me. I mean, I'm not fighting the system, but I'm not signing something that they gave us just to say, "Hey, can you please sign this?" No, because it didn't change.
Right. So when you came in, you signed an emergency involuntary detention order.
I didn't sign anything.
Oh, okay. So they gave you that document that said emergency involuntary detention order, and then later on yesterday, before this official move, you received a voluntary quarantine letter.
It brought to my attention that they put a pamphlet outside our door, and and the documents inside was some documents stating that it was voluntary.
Right.
See.
So it went from involuntary to voluntary, but the whole time you're saying it's been involuntary.
Yeah.
It kind of looks like they're trying to cover their dogging, maybe legally. That's what I'm guessing.
But I mean, that to me, that point is moot. I'm here. I got how many more days left? We're all here in this. The people I spoke to were just dumbfounded. As what are you trying to do? We're still in the same situation. Nothing's changed. We're not fighting the system, but they're trying to coerce us into signing a document that's.
Are people signing it, Dave?
Not the people I spoke to. One of my friends here said that they told him he has to sign it before he leaves. I said, if you don't feel comfortable signing it, don't sign it. Mm-hmm. Because the situation didn't change. I mean, that original document they gave us, to me, it's still in effect.
I think we got probably about 200 lawyers salivating listening to this phone call right now.
Yeah, I mean, there's public law that was stated on there. Had someone do some research into that, and it basically states that I guess they do have the authority to do this in a time of crisis.
Mm-hmm. Well, during the press conference yesterday, Linda did mention something, but I couldn't ask a question for whatever reasons. She noted during that press conference, and this is also from Crystal Pacos and Augustine when I talked to her yesterday about the information we received about quarantine passengers being moved, and she said that Linda will soon be appearing before the court to extend the quarantine order. I'm told that prior to her appearance, individuals must reassert their status, which is interesting because the statuses are different based on the documents that we have seen.
Yeah. I don't know what that means.
It means that when you came in, you were provided a document that said emergency involuntary quarantine, and then you were provided another document outside your door that said voluntary quarantine acknowledgement. I think that's kind of what it means. But, we'll have to wait for the press conference.
What I'm hearing it from different people who are involved with this is that they gave out the wrong documents. I mean, it could be something as simple as that. I mean, but outside looking in, it kind of looks like somebody messed up and,
Well, what else is new? Anyway.
Yeah, anyway.
Right.
So, hey, Dave, thank you.
We'll check in with you later for your another Chronicle.
You guys continue to do what you do and get the word out. Please stay home. And like I said, that guy,
stay home.
If you have that type of thinking of that same guy, I don't know.
Right, yeah, yep.
It's nothing to joke with.
Just think about it, guy. You're going to, when you finally see your chick after a quarantine, it's going to be so good. It's like Lent. You gave up rice for Lent. You don't eat rice for Lent. You just wait.
Day, Christopher.
Okay, thanks, Dave.
All right. Take care.
Okay. 9:55. What? It's still Lent. It's still Lent out here.
We wanted to push out the information, though, about what Kadu is doing, right?
Right, yeah. So what is Kadu doing?
I don't know. You're the one who told me. Come on now.
Gosh.
Quickly, come on.
Okay, so yeah, Kadu is doing a Kadu Caregivers program. It starts with you. You do a little donation. As little as $10 can feed 6 to 8 Manamku or children. Donate today, feed the needy, and help our team stay employed. Let me see this other piece here. So basically, you donate. The cash is accepted at Kadu, credit card online at Kadu Guam or the Grab and Go app. Of course, you can call 646 Kadu. Your donation provides the team to prep, cook, and package delicious and nutritious comfort food. You tell them who needs the food by way of Catholic Social Services. They help the chronically homeless and elderly, or via Manetlu, families with children struggling to put food on the table. And then Grab and Grub will make that food delivery.
And we actually have that information, I believe, on our social media.
Thanks, Bree. Right. Yeah, but I just wanted to give it to you live in person, because when the DJ says it, it means more.
But, also on our social media, particularly, I believe, on Instagram, we do have some cool challenges that you can do. And this is where Ken comes in and
Right
talks
on.
us about that.
Ken Sanity.
Hey, good morning.
Good morning.
So we have a lot of things going on our Instagram. We have the other day we asked people, how are you spending your time in isolation and quarantine? So people tagged us in their Instagram story, sharing videos of their kids singing or learning Chamorro, different things like that. So for the rest of the period of the quarantine, we are going to be promoting different activities. So today we have a color wheel for Teaching Tuesday. So every Tuesday you have activities for your younger kids to do. And today the challenge is to make a found object color wheel, where you go around the house, pick different objects of different colors, put them on a little table, and put them into a color wheel, which is apparently it's red, orange, yellow, green, blue, and purple.
The primary colors?
Yeah, the primary colors, and then the secondary
Bree knows her colors, Ken. Watch out.
I had to Google that one, but you put them together, you take a snapshot of it, a photo of it, and then you upload it to your Instagram story and tag us in it, and then we'll just share everybody's.
Like grapes.
Yeah, it could be anything. So some people, they do like their toys, or some people do the stuff that they have in their cabinet or fridge. So like cereals and bananas and different fruits. Let your imagination run wild. And that's what we have today, and we have different activities like that all week. So, yeah.
Hey. Gosh, you guys are so creative over at digital.
Right.
Man.
There you go. So, and you're seeing it all over social media. Our friends at Custom Fitness, they're doing that virtual workout. They post it every day. You can go on their story and see what the workout is for today.
I think I saw one where he had like Coors Light or something, and he was like lifting them up. I was like, whoa.
It's functional fitness, okay? It's functional.
Very functional.
Someone got to carry that beer.
Where's the spam? Let me give it to my son. Get over here.
Yeah. How many bags of Teresa's Espinal can you bench, bro? All right. 9:58. Thank you so much for watching Containing COVID. Got a lot of work to do today. There's a press conference at 1 o'clock. And so we'll bring you that one live, and there are all kinds of content rolling out on our KUAM News Facebook and social media platforms. Sabrina, thank you.
Thank you.
Good job
Thank you,
today.
everybody that's watching.
And again, one of the takeaways, what you should know is the public health emergency declaration has been extended another 14 days. Social isolation is mandatory, especially if you saw the press conference yesterday. The governor went on, and I saw the format they were trying to do. She went on, said we're going to extend the order. Then she brought in Linda. Then she brought on Dr. Cabrera to kind of show the people this is why. And so very compelling reasons. So, stay home. Heed the mandatory social isolation orders. If you don't need to leave your house, don't.
Right. Stay home, stay clean, stay bored.
There you go.
Stay with KUAM.
There you go. Just keep staying. You stay there, Guam. You don't go anywhere. We'll be back tomorrow morning Containing COVID, and bring you all the info you need today. Going to leave you with this one. Bonito na lugar. It's Big Ben and the boys. Biba, Anya Chamorro, Guahusi Chris for Sabrina. Adios.